Cool, cool. That should go away. Boom. So here, the larynx. Is this all this stuff right here, lab, or is this PowerPoint relative, important to you guys?
Honestly, I think all 13 is like, you can go over a lot of stuff.
Sure. Okay. So what is the larynx? Well, yeah, it says right there. It is the voice box. Good job. Yes, it is the voice box. So what is that? No, go back. Go back. Give me my pen. So it is, yes, it is the voice box. What does that mean? Form speaking sounds. Cool. Where is it located? Right near the epiglottis. Technically, it's right here. I'm gonna use a different color so you guys can see it better. It's right around here. That's what the larynx is. So, because it is inferior cutaneous with the trachea. So it's basically going to be attached to the trachea. So, trachea, food tube or air tube? Do not confuse them. I know it sounds like it's a joke, but students will always confuse those. So the trachea is the air tube. So larynx can provide three things. It's going to provide an open airway. What does that mean? I'll show you what it means in a little bit. Switching mechanism between food and air. So the larynx helps with this, but what specific muscle in general does this? The epiglottis does. That little flap right there, sorry, flap right here, my bad, flap right here, will close, open and close depending on what you're doing. So normally, when the muscle is relaxed, is it up or down? In a relaxed position. Are you always eating or always breathing? Always breathing, so that's gonna be up, right? So when you're breathing and talking, it's up. When you swallow or eat food, swallowing actually causes the muscle to contract and it closes it. We'll talk about it a little bit more on the digestive system. But I bring that up because you guys know when a muscle is not doing anything or in its natural state, it is considered a relaxed muscle. When you make muscle move, it's considered to be contracted. We'll talk about the diaphragm because the diaphragm's a bit weird at how it works. It works the opposite way you think it does. 17th epiglottis. And then it has the vocal cords. Helps us make the sounds. Cool. So we're gonna move on. So we're not in reproductive yet, so if you see a picture like this, do not think it's the other organ. It looks just very similar to this. I make jokes like this, but again, the jokes I make are serious. Students have confused this with that before. I don't know. If students have never seen things like this before, it's very easy to confuse them. Okay, so the vocal cords are actually called cords because they are like little tiny taut strings right there. So here's the opening that allows air to flow through, and when it closes up, air can't get through. What does that look like to you guys? Cancer, that's pus. So you guys ever hurt your vocal cords before? You guys never hurt your vocal cords before by talking or screaming too much before? And it hurts? Some people can have infections on the vocal cords. That's all that is right there, an infection on the vocal cords. Such as there. Not good. If the vocal cords are infected, can a person talk? No. So this is not going to be in a test, but you guys just know in general, if you've ever hurt your vocal cords, you see a patient that does, tell them to drink warm tea and honey. That works the best, and tell them not to talk at all. Whispering actually hurts the vocal cords more than normal talking does. Because when you whisper, you actually are forcing the vocal cords almost in a semi-closed position to lower your pitch down, right? So talking normally, vocal cords are open and they're vibrating normally. To whisper, you're changing the way that they're working per word. So it's actually more harmful to whisper than it is to talk. Okay, trachea. What's the point of the trachea? Is the food tube or the windpipe? Air the lungs. So, first off, why does the trachea have these rings right here? Keep it open. What are those rings made out of? What type of cartilage? Hyaline cartilage, good. And the point of that is to keep the airway open. Because right in a little bit, we'll talk about some chemistry, which I know you guys love. We're talking about Boyle's law and Henry's law, which are going to help you understand why we need pressure, these things to keep open. Good. Here's a cross section. This is more lab stuff right here. But here's a big opening. And here is cartilage. So this is the front. This is the back. Hey, what's this thing right here? Esophagus. So why do you want the esophagus on the back of the trachea, not the front of the trachea? What goes down the esophagus? Food. You guys ever eaten a giant piece of food before in your mouth? If the esophagus was in front of the trachea, it would compress the trachea. Do you ever want to compress your trachea? No. That's why the esophagus is behind it. Good. Okay. Going down here, we have a right and a left. So did your professors talk about the difference between the right and the left bronchi? So I outlined it. So they are connected, right and left. One will kind of go straight down, more vertical. One kind of takes a weird horizontal turn. Why is it? Why is the left like that? Heart's right here, right? The heart's going to be on the left side. So the lung is going to compensate for that by being off-centered a bit. That makes sense? That's more lab question. This is a lab and lecture question, if you haven't had it. Which side is things more likely to get trapped inside of? Why? So let's say I have a patient, little boy named Tommy, and Tommy eats a rock. And eating the rock, he's crying because his parent yelled at him and he's freaking out. The rock will most likely fall down the right side because it doesn't have to make a sharp left turn. Does that make sense? So when a patient is choking, or if you feel something's blocking the patient's lung, always check the right, then the left. That could be a lab, it most likely was a lab question. It could be a lecture question, depending on who you have. Hall likes that question. Wireman and Premack usually like that question as well. I don't know about Barton too much. Okay. What is this right here? Tensionalis muscle, or sorry, trachealis muscle. Trachealis muscle is right here. So going back to 210. What is ANS? Autonomic, what's that mean? It's non-voluntary, right? It's automatic. What two systems control autonomic? What is sympathetic? Fight or flight. What is stimulated by the sympathetic? What stimulates sympathetic? What's the hormone? Epinephrine or epinephrine, right? So if epinephrine is injected or epinephrine is released by your body, what happens to your heart rate? What happens to your breathing? Well, the reason it increases is because the trachealis muscle actually, in a way, relaxes more and it opens up your trachea even more, so more air can rush in. If the muscle is stimulated by the PNS, the parasympathetic nervous system, what happens to it? Kind of contracts a little bit and closes up, right? Kind of it doesn't tighten up all the way. It is a little bit, right? Because do we ever want our airways completely collapsed? Why not? Is breathing kind of important? Kinda. No, you don't think breathing is important? Okay, we'll talk about that in a little bit. Okay, so yeah, primary, secondary, and tertiary. It goes primary to secondary to tertiary. So primary is the biggest, then it goes on to secondary, which then branches off to tertiary, which then branches off to bronchioles, which then branch off to terminal bronchioles, which then branch off again to alveolar sacs. Everyone understands this so far? Okay. Bronchioles contains smooth muscle. What does that mean? If something has smooth muscle, can you control it? Yes or no? Yes, you can. So a lot of our lung diseases are going to affect the trachea or the bronchioles. That's it. Everything else in the trachea is basically a hollow cartilaginous tube. Make sense? Just kind of like the blood system. We can only control the arterioles. We couldn't control the arteries, the veins, or the capillaries. We can only control one of them. Thus, we control the entire system, right? Kind of makes some sense. Here, we can only control the bronchioles, and thus that will help us control our breathing. Okay. Boom. So, I doubt you have to examine anything in class about x-rays, but just in the case, oh, it's too red. Madison, you there?
Yeah.
Okay, just making sure. First off, lungs black. Should it be black? Yes, that's air. You take an x-ray, the lung should be black because what color is bone? White. Air in x-rays is black, right? So the lungs should be black. What's that? That's something that should be there. It's a nail clipper, right? That's in the lung. Should it be there? And look down here. What do you see here? You see white in the lung, which right here should be black. So is that nail clipper obstructing some airflow? Is that bad? Yeah. That's how you look at x-rays for the lungs. It's not going to be very important now, but in pathophysiology, it will be. You will give them x-ray pictures and determine like, hey, what's kind of wrong with this lung? And it's very obvious ones, but it's just nice to know what's going on. Okay. Again, trachea, primary, secondary, tertiary, bronchioles, bronchioles, terminal bronchioles, and then you got to alveoli sacs. So where does gas exchange occur? Gas exchange is caused in the alveoli sac, right? Tube, a little bit of muscle right here, and then it's where gas exchange occurs. So most of the lung really isn't important. It's just a hollow tube to the outside world. Cool. So here's what an inside of a sac looks like. Here's some sacs. Here's what they look like, all the proteins wrapped around them. Got pulmonary vein and a pulmonary artery going up. Cool. Okay. So let's talk about some things. So when I say bronchodilation, what's dilation mean? Expanding. What's expanding? The bronchioles, right? Bronchial constriction. What's constricting? Cool. So if something is if it's activated by the sympathetic nervous system, it's going to open up the airways, causing us to breathe easier. Parasympathetic causes it to contract a little bit, right? Histamines. What cells release histamines? Mast cells. Cool. What do histamines do? For allergies, they cause inflammation. If something's inflamed, what's that mean? It's big and red because of what? What's red in our body? Blood. So if something's inflamed, it's big and red because a lot of blood flow is there. If a lot of blood flow is in the bronchioles, right? How big were the bronchioles? Let's clear everything. Erase all link this way. Here are the bronchioles right here. How big are they? Not very big. If a lot of blood gets flown there, what happens? They collapse. Is that good? No. Unfortunately, our body doesn't know the difference. It's going to do it on purpose because it's an outside source, but it's not very good. So, yeah, so inflammation is released when you're sick or hurt. Asthma. Who has asthma? Any of you guys have asthma? Oh, you guys are all lucky. Darn. So again, bronchial, bronchial. Nice bronchial. Unhappy bronchial. It's red, it's inflamed, and it's got some mucus in it. On top of that, is that bronchial useless, pretty much? Yes. How would your body try fixing that issue with all that plugged up mucus? You cough. You try coughing it up. Okay. Well, coughing things up. If you cough, are you inhaling or exhaling? You're exhaling. Are you inhaling at that moment in time? No. And that mucus could get dislodged again, right? So coughing isn't the best way of fixing asthma, but your body is the smartest thing in the world. It's going to fix the best way it knows how. When something's in the lung, what it tries to do, it tries to open up and cough. To fix it, we need to take albuterol, which is the most common way asthma takes, inhalers use. Albuterol is a chemical. It's going to cause bronchodilation. Now, going to go all the way back to beta-1 and beta-2. What's beta-2 going to affect? Lungs. We have two lungs, one heart, right? So albuterol is actually going to increase lung flow or lung ability because it's going to increase dilate bronchioles, so bronchial dilation. There is a little bit with beta-1. Why would I also want to stimulate the heart with beta-1? More blood flow. If the heart starts beating faster, what are you going to do? You're going to breathe because these two systems are connected, right? The circulatory system is connected because what's part of it? What does the right side of the heart pump to? The lungs, right? What's the left side pump to? So if your heart's beating faster, blood's going to go to the lungs, right? If blood's in the lungs, what's the lungs going to do? Get the blood out of there as fast as possible. So if you increase heart rate, you increase breathing. If you increase breathing, you increase heart rate. They are connected. It's very hard to do one without the other. I'm not going to go in depth. I don't think you guys need to. You just need to know that asthma is bad. It's going to cause constriction and mucal secretion because of some type of irritant. So, alveoli, you have two types, type 1 and type 2. Type 1, called pneumocytes. What does pneumo mean? It means lung. What does cyte mean? So there are lung cells. So lung cell type 1, these are the ones that actually do gas exchange. Cool. Pneumocyte 2 produce a thing called surfactant. Why is surfactant important? It decreases surface tension. So, does air have water in it? Yes or no? Are the lungs moist? So inside these fluid-filled sacs, there is water. What does water want to do? If I have two beads of water and they come together, what happens? They come together and they form, right? Water likes to form with each other. So here's an alveoli. Here's just one alveoli. The water is going to pull on each other because it wants to connect, but also wants to connect with each other across the way too. And you look at this, what happens? It's going to collapse the alveoli sac. This is bad. Why? Because you can't breathe. You can't exchange gas, can't exchange oxygen, can't breathe carbon dioxide. So we have this surfactant, which is basically a soapy material. Soap is a surfactant. It just breaks up water tension, right? So we make the surfactant. Now, the first time you're born, the first breath you do, it pops open your alveoli and that's when you start producing surfactants. However, some infants, very premature ones, the last thing to be produced in our body is surfactant. This being, why would you start making surfactant if you're not going to be born yet, right? It's the very last enzyme protein that is made. So premature infants have a higher risk of not having surfactant, which can cause what to happen to their lungs? The lungs can just collapse on themselves. Not good. Okay, we're not talking about water because water is all good. We talked about that already. Okay, more alveoli sacs. Boom, boom, boom. Okay, that's just histology. Cool. That one's done. Does that make sense to everyone? And any questions on the things I just covered? That's more of lab stuff. Let's talk more about other stuff. Okay. So, the alveoli. Do they have contact with blood? Yes or no? No. There is a little membrane between. So the alveoli, the alveoli is separated by blood from pen. Is separated from red blood cells in the bloodstream by the blood vessel itself, the capillary, is basement membrane, and then the thing itself. So it's separated by 3 layers. All right? Looking at this, is that thick? Yes or no? Do you want your alveoli to be thick or thin? Why? What 2 gases? Oxygen, carbon dioxide. Good. What are some downsides to the alveoli being super thin? We already talked about one of them with water tension. They can collapse very easily, right? If something gets inside of there, they can burst very easily, right? That's why they hurt very, very, very easily, especially if fluid starts being formed in there. Okay. So what is diffusion? From high to low or low to high, right? Good. Talk about a bit more. And then, you guys ever heard of pneumonia before? What's pneumonia? Fluid in the lungs. Where in the lungs? It's in the alveoli. So when the sacs start producing fluid, that's bad. Why? You can't breathe. If you can't breathe, what happens to you? You die. I keep saying this because pneumonia is a very, very dangerous thing. With the coronavirus, most people don't really die of the virus itself. They die of complications of pneumonia from the virus. Okay, pneumonia. Alveoli is filled with fluid. That sac right there, it's useless until that fluid is gone. So how do you get the fluid out? You cough, right? Sometimes you get the fluid out. Over time, if that's not fixed, this entire thing is dead. Great. Look at that lobe of the lung right there. If that's all filled with fluid, that entire side of the lung is dead. It's not good. It's why pneumonia can kill you, because it can slowly start suffocating your lung from being able to do things. What's very interesting when you listen to this, sometimes they're not fully full of fluid. So when they breathe, it actually sounds like their lungs are cracking like Rice Krispies. Or when you pour milk in a cereal, that crackling sound, that's what the lungs sound like rice crackers. Because air is trying to move through the liquid, causing it to almost become a popping sound. It's really interesting. Okay. Again, normal lung, white space, a little bit of white space here. Not the best, right? This is very bad. There's a huge part of the lungs that is not doing that. Okay, pleura. So what's pleura mean? Space, right? So we have a visceral layer and a parietal layer. What's the visceral layer touch? Touch the lungs. What's the parietal layer touch? Everything else, right? So if you have this and this, you're gonna have a space in between, which is the parietal space. So parietal space is interesting because why do we want a big parietal space for the lungs? Why do we have extra parietal space there in the lungs? What do you breathe in? What do your lungs do? They expand. So we want some space where they can expand into, right? Does it make sense? Cool. There's a problem though. That's empty space, right? What can fill in that empty space? Fluids. Do you want fluids pushing down in your lungs? Why not? Say, for example, this is full of blood because you get hit in the ribs. And the ribs puncture the space. Now this place is filling with blood. Can this lung expand anymore? No. You also have pressure pushing down in the lungs, which means the lung is going to get squished. Can that lung breathe efficiently anymore? No. That's bad. Okay, cool. Yep. There is a little bit of fluid there, and what that fluid does is it keeps the area nice and lubricated. So if the lungs ever if the visceral layer ever touches the parietal layer, they don't get inflamed, right? It's a little bit of lubrication. but very, very few. So one example is if the parietal space is punctured and causing pneumothorax, which is a collapsed lung. Is that bad? How would you fix that? What caused the lung to collapse? A lot of pressure is being pushed onto it. So you need to figure out a way of making the pressure normal again, where the lung can expand normally, right? So normally, something's stuck into the lung. If you cover the hole up and suck air out of the body, it will usually expand back out. Very interesting enough. Kind of make some sense? Cool. The hemothorax. Blood. So here's the difference we know with hemothorax and pneumothorax. What does pneumo mean? Air. What is thorax? Thorax is your chest cavity. So what's in your chest cavity? What's in your chest cavity? So pneumothorax, there's air. There's air pressing down on the lungs. That's why I said if you suck the air out of here and close the wound up, the lung will inflate back up normally. A hemothorax, what's hemo mean? What's a thorax? Chest cavity. So now there's blood in the chest cavity. That make sense? How would you fix a hemothorax? Chest tube. And then what do you do with the chest tube? Take the blood out. Like this guy right here is doing. Fun. Cool. Okay, now we're going to talk about what the lung does. Woohoo. So, lung has circulatory properties and respiratory properties. We need to know both of them. Even though respiratory is technically done with, it still comes up in play. Yay! What law is that? Boyle's law. So Boyle's law says that pressure and volume are inversely relation to each other. Basically, if pressure goes up, what does volume have to do? Go down. And if pressure goes down, what does volume have to do? Go up. So this is how our lungs work. I take a deep breath, right? My diaphragm expands, right? My chest cavity also expands. So what happened to my volume in my chest? It increased. What happens to the pressure then? It decreases. So is the pressure inside my body less than the pressure on the outside of the air? So where's the air want to go? No, if I breathe in, volume's high here, pressure's low, air rushes in to fill in the space. That's how inhalation works, right? Exhalation is you relax, everything goes back to normal, pressure's equal, breathe out. Breathing in requires effort. Breathing out is nice and relaxing. So what that means is when you breathe in, you're contracting your diaphragm. So you inhale, diaphragm has to move, right? That's contracting. When you relax, diaphragm gets smaller, but it's relaxing in a way. Make sense? So a way of thinking about this is inhalation is a active process, exhalation is a passive process. You need to know that because it's going to come up with some diseases in a little bit. Okay. During exhalation, pressure is equal or more inside the body than outside. That's why air gets pushed out and wants to leave. Okay. That cat just looks weird and does not look happy at all. Okay, so basically what this is saying, this right here is saying what I was saying. When you inhale, diaphragm expands, all the muscles in the ribs, they push the ribs out, the chest gets bigger, more volume, less pressure, air gets in. Exhalation, diaphragm contracts, All the things go back out. We push air out. Okay. Making sense? What does inhalation mean? Breathe in. It's also called inspiration. So inspiration and inhalation means the same thing. And you have expiration or exhalation, which is just breathing out. The terms can be used vice versa. You can use vice versa. So please know the terms what they mean. Okay. So the real story is basically the thing I told you. The only difference is that there's quiet breathing and there is loud breathing. And that is a horse, I believe, where they're pumping air into the lungs. So that's fun. Okay. Compliance. So if someone is compliant, what's that mean? They're willing to do something, right? So if doctors use the word compliance, it just means how willing the lung is to do something, right? So the lung is happy, is it willing to do its, is it wanting to do its job? If the lung is unhappy, does it want to do its job? What can make the lung unhappy? It can be inflamed, it could have pneumonia, you could have the disease, right? All those make the compliance go down. Making sense? Cool. Okay. So, what's going on here? So what this diagram is showing is someone who has emphysema, someone who has normal lung function, someone who has fibrosis. So let's talk about this. Emphysema, they're called pink puffers. They're barrel-chested. What does that mean? So don't get there too yet. We'll have it later. But if I say barrel-chested, what does that mean with their chest? It's big. When does a normal person's chest get big? During inhalation, right? So people with emphysema, they're constantly in a stage of inhalation. That makes sense? Means they basically can always breathe in air. They're almost always breathing in air. Their chests are always contracted. That's why they can breathe in more air. Make sense? So if you suck in more air, chest gets bigger and bigger and bigger, right? Issue is, if the lungs are always almost in a state of inhalation, can they contract and push air out easily? No. So they have a problem of breathing air out, but have an easy time breathing air in. That can make some sense? What problems would you see in this person? Why are they called pink puffers? Do they have a lot of oxygen in their blood? Yes or no? Yes, because they can only almost breathe in. They can't breathe out very well, right? So it's weird because their blood has a lot of oxygen and CO2. Very, very elevated levels of this, which will be a problem later on we'll talk about, right? Fibrosis. What does fibrosis mean? Hardening the lungs. The lungs are almost like stone almost, right? This is very, very bad. If the lungs are nice and hard, can they expand and contract? Can they breathe well? No. You bleeding? You okay? Okay. Make sure you're good. That's what this lung is saying. So who has the toughest time air getting in the lungs would be fibrosis. Time getting out would be emphysema. Making some sense? Okay. I don't know if a graph like this will be shown, but that's what the graph is meaning. Okay. When you're breathing in, diaphragm moves up and air moves in. Okay. Here are the muscles that help. All of them. I doubt you need to know them, but a lot of your muscles around the ribs help with this. Cool. That make sense with that one? Madison, you still with us? Cool.
Yeah.
Make sure you didn't fall asleep again.
Nope.
Okay. This is the one you probably want the most help with because this is all the terms of rates and volumes and compliance and stuff like that. Okay. So first off, respiratory rate. It's a rate. If I say the word rate, what pops into your mind? Okay, nothing then, okay? What should pop into your mind is time. So respiratory time, what's that mean? How many breaths per minute? Volume, do you know what volume means, my chem students, right? It's how much air is moved out, right? So ventilation is basically going to be how much air is moved out at a given time per breaths. Does that make sense? That's what pulmonary ventilation is. Tidal volume is how much air you breathe out per breath. So are our lungs 100% efficient? Yes or no? No. When you breathe air in, not all the air will get to the alveoli sacs and do gas exchange. Some air will be trapped in the bronchial and the trachea and the bronchioles, right? That's referred to as dead space. We don't care about it. It's dead to us, like my ex. You guys are laughing now. It's good. Okay. Alveoli is where you want the air to go. Okay. You guys are laughing. That's good. So this freaky chart is going to be very helpful to us. So I'm going to note this out so I don't keep jumping back and forth so that we can just stay in this one chart and look at what these things mean. Okay, first up, tidal volume. We already talked what tidal volume is. Tidal volume is how much air you breathe out per breath. If you look, it's pretty consistent through the entire thing, right? All these big jumps and divots, that's not normal breathing then, correct? You look at it? Okay, we want you to know that with tidal volume, you only care about the normal breathing of inhalation, exhalation, inhalation, exhalation. Okay. Next up is inspiratory reserve volume. What this means is how much air you can force into your lungs. So it's the deepest breath you can get to force as much air into your lungs as possible. Why is this important to look at if you're examining a patient? If this number is low, is that bad? Yes, because they can't force air into their lungs. Should we be forcing air into our lungs at normal breathing? No, we should not be forcing air into our lungs normal breathing, right? It should be nice, passive process. Are there times where during exercise we have to force air into our lungs? Deep breathing, right? So there are times where our body needs to do this. As a doctor, if this is super low, it means the patient has a problem somewhere. Most likely the lungs can't expand, right? Which means some blockage is occurring or dead tissues there. Fibrosis is a good example. Tuberculosis or other issues like that could occur. I don't think you need to know about tuberculosis in this class. Tuberculosis? Tuberculosis is a bacteria that gets into the lungs and starts making it Swiss cheese. It is. And you actually start coughing out lung because the lung is being broken down. And again, what's something in your lung? What do? You cough it out. So you actually start coughing out bits and pieces of your lungs. Yeah, it's interesting. And once you have tuberculosis, you always have tuberculosis. It comes in waves. So those of you who are in 182 or microbiology, endospores, what are they? Dormant bacteria in an enclosed thing. If someone has tuberculosis, you can see the endospores. You just can't get rid of them because they're inside the lung tissue. What's the only way to get rid of it? You have to go inside and cut the lung tissue out. Do you want to do operation on the lungs? Yes or no? No, because the lung tissue repair itself. No, only one type of tissue can repair itself. What's that one type of tissue that can regenerate? The liver. Liver is the only organ that can regenerate itself. Yep. Well, why does the liver have to regenerate itself? What's the liver do? Huh? It filters or detoxifies our blood. So if we drink copious amount of alcohol, because it's, I don't know, St. Patrick's Day weekend, that poisons your liver. So your liver actually kills itself to protect you. So it needs to be able to regenerate itself. Okay. Now, enough about that. Let's talk about more about the lungs. So, up next, instead of the exact opposite, you have expiratory reserve volume, and that is how much air you can force out. So if that's very low, is that bad as well? I mean, you can't force air out of your lungs. Yes, it is. Very, very bad. Those are the volumes. Up next, you have capacity. Well, let's say you have one more residual volume. And residual volume is a weird one. And what residual volume is you'll tell a patient, it's how the best way of talking about residual volume is you tell a patient do two normal breaths, then breathe in as deep as possible, then breathe out as much as possible, right? So, right? And how much air is left in the lungs after that forceful breathing out is residual volume. It's how much air is left in the lungs after trying to force all the air out. Does that make sense? If there is residual volume, there is trapped air in the lungs. Is that bad? It could be, it could not be, right? Air always will be trapped in the lungs, right? If it's a lot of air trapped, that's bad. A little bit, that's fine. Okay. Inspiratory capacity is how much air they can force in their lungs after normal breath. So you tell them to breathe normally and then deep breath, then exhale, right? It's how much air they can force in with one deep breath. It's different than reserve volume because reserve volume, it's inhaling until it hurts and then stopping. This is how much air you can force in your lungs with one deep breath after normal breathing. That make sense? Cool. And then you have functional residual capacity. And this is how much air is in the lungs during normal breathing. So this is the most important one you'll see in normal breathing. It's the curves of the tidal volume. Does that make sense? And then total lung capacity is how much air they can force in minus how much air they can force out. Make sense? The graph might make more sense and those words make more sense than they did before. The entire point of this is to test for lung conditions, right? So the best way of looking at this is if it has inspire, it means breathe in. Expiratory, breathe out, right? Reserve volume. So something is, if you're reserving something, what's that mean? You're saving it, right? So if you're saving air, you're not breathing out. You're trying to hold as much air as possible, right? That's what reserve volume is. You can imagine that, right? Expiratory reserve volume is how much air you can push out, right? It's volume. Capacity is something different. And we have two more. We have vital capacity and then total lung capacity. Vital capacity is just how much air you can breathe in one deep breath and one exhale breath, right? That's vital. If you need air in a moment, like in a crisis, right? That's how much air you can breathe in and out more quickly to save yourself. That's vital air. Kind of makes some sense? Okay, Madison, that makes sense to you?
Yep.
Cool. Okay. Use those words already. We used those words already. Kind of talked about that already. Okay. Gas laws. So, partial pressure, which is Dalton's law, is saying that the pressure of air is the pressure of all the individual components by its abundance together, right? That's not important. What's more important is Henry's law. And what Henry's law says is if I have this nice can, I already cracked it open. When I cracked it open, what happens? Air goes out. What Henry's law says is if I apply pressure on a gas with a liquid, right, the gas will go into the liquid. If I compress gas enough, it will be forced into liquid. If I release the pressure, what's the gas going to do? It's going to leave the liquid. This is very important because what's blood? What's gas? What's oxygen and carbon dioxide? So under Henry's law, if I force pressure onto the blood, I can force CO2 and O2 into it, and when I relax it, I can force it out of it. Does that make sense? That's why Henry's law important is for breathing. It's for blood and gas. Example is with soda. Okay, So the big key ones for breathing are CO2, O2, and nitrogen for this one weird example. So CO2 is very soluble in water, which means if I put a little pressure on it, it will go in water and dissolve in water. O2, a little less so. Nitrogen, it doesn't want to be with water at all because it's a diatonic, right? It's non-reactive. So, any of you guys ever gone scuba diving before? You go scuba diving, you have to pressurize yourself with air, right? Because what's in there? Air, correct? Is it just oxygen in there? Yes or no? You want to breathe straight oxygen? No. It's oxygen plus a little nitrogen, a little carbon dioxide too, right? You want a mix of both, but it's mainly oxygen. But there is nitrogen in there. So say you're in deep sea scuba diving, right? Pressure is deeper in the bottom of the ocean or the top of the ocean? Bottom of the ocean, right? So all that pressure is pushing all the carbon dioxide and oxygen and nitrogen into my blood. If I shoot up like a rocket too quickly, what's all the gas going to do? Escape, right? Which can cause a disease called bends. Now, if I go from low pressure to high pressure immediately, I will blow up and explode. Hence, if you go out in space, your lungs blow up. So does all your blood. It boils immediately because of this. Now, with scuba divers, if they accelerate too quickly, nitrogen gets released too quickly, which means bubbles start forming in their blood. Is that bad? Yeah, bubbles should not be in your blood, which can cause bends or decompression sickness. That's why you have to kind of come slowly over time. Now, can you see this in other cases besides scuba diving? What other cases is a patient under immense pressure? Airplanes. So if you're in an airplane, the airplane suddenly starts going down like a nosedive too quickly. That's bad. That's why airplanes have to slowly descend and slowly ascend. That make sense? Well, they kind of circle a city once or twice as they slowly descend, right? If a patient, some patients are more vulnerable to decompression sickness than others, depending on just how body chemistry works. So if someone is very, very susceptible to it, the pilot can actually cause decompression in just a person normally doing something. Cool. What other times can a patient be under immense pressure besides flying? You guys ever seen a sterile room before? Nope. So you guys have not seen a sterile room before. They're very interesting. You guys probably been in an infected room before, but basically it is a glass box which you have to walk into a room which shoots a bunch of air out at you to clean the room out so that it basically allows no foreign bacteria inside the room. It's a clean room basically. The patient in the clean room actually is under more pressure than outside, and that is to keep everything inside the body instead of outside the body. So if you take the patient from the clean room and I throw them outside real quickly, they can get depression sickness. Okay. So pulmonary vein. What's the pulmonary vein carry? Oxygenated or deoxygenated blood? Good. That's why you have to think very carefully. It's oxygenated. Pulmonary artery. Deoxygenated. So the partial pressure of oxygen inside the pulmonary vein is super high. Does that make sense? Because it's carrying oxygenated blood where? To the heart. Pulmonary artery, it's a 50-50. Does that make sense? Cool. So here's why gas can exchange. Small distance, there's a gradient. Gas molecules are actually lipid soluble, and the lung has a giant surface area. So if I were to take one of your lungs, two of your lungs, it's about as large as a tennis court if I unravel it. Has as much surface area, which is very interesting. Same thing with the intestines. If I unravel it, it's about the size of a football field. So you have all that surface area inside your body, which I think is very interesting. Okay. So first things first. Deoxygenated blood, high oxygen, low oxygen. Deoxygenated blood. Low. So when that deoxygenated blood comes up to the lungs, right, what's going to want to go into the blood? Oxygen, right? Because it's going to diffusion, high to low, right? So all the oxygen in the alveoli is, shoot into the blood, right? And then if I inhale, right, what's a lot of things I inhale? A lot of oxygen, correct? So all the CO2 wants to leave because the blood has a lot of CO2 in it, not a lot of oxygen. So they kind of switch places because of diffusion. Does that make sense? That's the bare bones. So now we'll talk about with the body. If I think about my thumb, right? Does my thumb have a lot of oxygen to it compared to my lungs? Yes or no? No. So when the blood reaches my thumb, it's going to deposit all the oxygen there and bring the CO2, and that's how diffusion works with the things. Does that kind of make some sense? That's the primary concept of how blood cells will load and unload CO2 and oxygen. All right, blood cells. Remember this? Hemoglobin. What's hemoglobin do? Carries the oxygen. What part of the hemoglobin carries the oxygen? Which part of the hemoglobin carries the oxygen? Is it the alpha, the beta, or is it this heme molecule? It's the heme. And what makes it the heme up? Iron. So if I have an iron deficiency, do I have a lot of heme in my blood? No. Am I transporting a lot of oxygen? No. I have anemia. That's bad. This is very common for vegetarians to have. Because they don't eat a lot of protein. A lot of protein, how we make a lot of iron. So they take iron and stuff supplements. Okay. Same with precious anemia too. Okay. Moving on. I don't like this page. I like this one much better. Now going back to my other previous ones, how it works is this is a taxi. Well, technically this is an Uber. I think this is an Uber instead, right? So none of you are old enough, but when you are, you can celebrate St. Patrick's Day, right, with your friends. And when you celebrate St. Patrick's Day, what do you do usually on St. Patrick's Day? What do most people do on St. Patrick's Day? They drink. Should you drink and drive? Did you just do this? Oh my God. Okay, sure. Okay. So you should not drink and drive, right? You shouldn't. Most people do, but you shouldn't. So one little thing called Uber or Lyft, right? If you have a group of friends and one person suggests an Uber, they'll pay for it, right? Hey, I'm gonna hop on too, because it's easier free, right? Well, 2 people pay for it. It's cheaper. Happens to 3 people split the bill. It's even cheaper. Get the 4th person in, and I'm paying like a $20 ride to my house could now be like $3. I split my friends, right? Boom. So when one oxygen molecule binds to hemoglobin, it makes room and it pulls more into it to be more efficient. Make sense? And the same thing is true. When you force it out, it can easily pop them out as well. Is this making sense from my last analogy of it? Okay. So normal oxygen levels should be between 95 to 100%. If you fall below 90% blood oxygen levels, you're considered hypoxia. So 95 to 90, is that a big difference? Yes or no? 5. So it's big, it's not too big, right? I don't think it's a big difference. So that's about 5 points. That's not a lot of points. I dropped down to 80 and I'm already failing my organs are dying, right? This is how you guys see your grades, right? This is good. I know when Kelsey and Madison see this on their test, they start freaking out, they're failing. And then if any of you guys see this on your exams, you're dying of a heart attack, right? Pretty much. Body works the same way. 80 or less, you're just gonna die. Not good. And that's what these things measure. Now, be lucky. When I shadowed, we had access to this. I had an old Ukrainian nurse I had a shadow with. She's like, no, you do old-fashioned way. and I walk up to a patient and then do the pressure. And some people are very easy. Old people are a pain in the butt to get blood pressure from because their skin is just so thin. Press too hard, you're going to leave a bruise. So it's very, very hard. So these things are a lifesaver. Use them as much as possible. Use technology. Okay. So what this means is when oxygen is high in the blood and low in the tissues, they swap. If oxygen is ever low in the blood and high in the tissues, is that bad? Yeah, because then you're pulling oxygen from the tissues into the blood through the fusion. So when you're low on oxygen, it's how organ failure occurs. One, because you're pulling any excess oxygen in the organs into the blood, and then the organs can't get extra oxygen, sorry. That's why it's bad. So it technically is a weird spiral. Here's what can affect hemoglobin. I don't know why that's a ghost / vampire. That makes no sense. Okay. So when the pH goes down, and when pH goes down, is it more acidic or less acidic? So when the pH goes down, oxygen hops onto hemoglobin easier. Now, basically for this chapter, if pH goes down, means high CO2. CO2 is an acid. So if you have low pH in your blood, right? It means you have high CO2 in your body. All right? That will affect hemoglobin because if you have a lot of CO2 and if you have a lot of CO2 and not a lot of oxygen, gas exchange will occur easier. If you have high pH, what's that mean? More basic. So you have low CO2, means high pH, right? Which means you're saturated with oxygen. Are you going to give up oxygen easier? Yes or no? No, oxygen doesn't want to stay in the blood, right? It's not going to want to leave the blood. Okay. With temperature, if you are warmer, oxygen's easier to pop on and off, which makes sense, right? Because as temperature increases, gas molecules move around easier, right? If your body is for some reason 10 degrees Celsius, which is almost freezing, which is going to kill you, right? Not good, but you're not going to exchange any oxygen because basically you're dead. Making some sense? So high temps, low pH, hemoglobin's more efficient. At high pH and low temperature, hemoglobin is inefficient. So when pH temperature are opposite each other, it affects the effectiveness of hemoglobin. Is this making sense? Cool. If your blood is above 7.6, it's considered alkalosis. If it's less than 7.2, it's considered acidosis. 7.4 is where we want it to be. Cool. Carbon dioxide. It's also considered carbonic acid. That's why you consider it an acid. Okay. The Bohr effect. There are two effects you guys need to know. The Bohr effect, and then we'll talk about the Hallow effect, something like that. It starts with an H. The Bohr effect, what this means is the higher amount of CO2 in the body, the more likely you are to take oxygen in. Because carbonic anhydrase will catalyze CO2 into carbonic acid, then carbonic acid then shoots it off as CO2. Here we go. For example, let's just say that's my thumb. I've been moving, right? It's going to give the blood its CO2 when the blood gives up its oxygen, right? They exchange each other. Well, CO2 plus this carbonic anhydrase will make carbonic acid. That carbonic acid then sticks into the blood, making it more acidic. That makes sense? That's how blood carries CO2 around, as it carries it in an acidic form, called carbonic acid. When you get to the lungs, Carbonic acid then breaks up to CO2 and water. We kick out the CO2 and bring in oxygen. Does this make sense? Yes or no? I think you're giving this weird look. What's up? Okay. So how does hemoglobin carry oxygen? With iron, right? The heme group. Does heme work with CO2? Yes or no? No, it doesn't. So we have to have some other way of making blood carry CO2. It does that by taking the CO2 and turning it into a larger molecule so it can trap it inside itself. So step one right here, this right here is considered a tissue, right? Think of anything in the body that's not the lungs, right? So for example, my thumbs, my fingers, my hands, my biceps, whatever you want, right? A lot of movement means you use a lot of oxygen up to make a lot of ATP, right? You might make a lot of CO2 as a byproduct. So does the tissue have high CO2? Yes or no? So a lot of CO2 here. The blood, oxygenated blood, a lot of CO2 or a little bit of CO2? Little, right? Diffusion, where's the CO2 going to go? It's going to go, wants to go into the blood, right? Oxygenated blood has a lot of oxygen, right? So it's going to give oxygen up and take in CO2. Well, because blood can't carry carbon dioxide, right? It uses an enzyme called carbonic anhydrase to take the CO2 and make carbonic acid. As a byproduct, you make bicarbonate, which is a buffer. So it kind of makes an acid with a buffer, so it kind of resists a little bit of the change of pH. That makes sense? That's why the normal blood volume, sorry, blood pH should be 7.4, right? Even though I'm making my blood more acidic, at the same time, I'm also making a buffer to counteract it. Does that make some sense? Because in chemistry, what does buffer do in chemistry, guys? Resist the change in pH, right? Good. Now, when I go to the lungs, I have a lot of CO2 in my blood, not a lot in my lungs, right? So then I convert the carbonic acid to CO2 and I breathe it out and I take oxygen in. Does that make sense? This is the Bohr effect. For oxygen, sorry, for red blood cells to carry CO2, they have to convert it into carbonic acid. At the same time, they make an acid. They also make bicarbonate, which is a base. So it lowers the pH a little bit, but keeps it stabilized because of the buffer. This makes some sense? Okay. Bohr effect again, Bohr effect again. Talk about this in a little bit. Talk about it in a little bit. So basically, if you exercise, pH of your blood is going to go down. Why? More CO2. So you're going to have more acidic blood. Good. Now we're talking about little parasites. So, what is this word? Fetal, which means what? Which means babies. I call babies what they are. They are parasites. They are parasites, and here's why. Fetal hemoglobin has more affinity to oxygen than it does to normal hemoglobin. So, your little bundle of joy first has to attach to your uterus by fusing with your uterus. So it literally fuses to the uterus and starts stealing your blood. From the blood, it starts stealing your oxygen. So what do pregnant women have? They have less blood sugar, and less oxygen in their blood. Fun. They're little parasites. So that's how babies breathe in the womb. They literally steal the oxygen from the blood of the parent. Isn't it great? It's cute. You have a little fishy dinosaur we'll talk about next exam. So I guess here we'll talk about this in a little bit, but yeah, llamas are very, very good at absorbing things. I don't know what we have here. I like llamas because llamas are better guard dogs than dogs are with farm animals. Because if you get a llama in a herd of sheep, it will actually become part of the herd and then protect them. So when sheep get cold, the llama will actually walk up to the coldest one and warm it up. They all kind of cuddle together. And then it protects it. And what's really good about this is it eats the same thing sheep does. You can shed it for wool, just like sheep around the same time. So it's very efficient. It's more efficient to get a llama and alpacas than it is to get guard dogs. Yes, I did. I'm going to. That's the, like, after get my doctorate and stuff, I'm actually can afford time off. I'm gonna have tons of llamas and tons of goats and tons of that. Sheep, the last things I'm gonna get, because sheep are hard to take care of because they are smart but dumb animals. Goats are great. The problem with goats is you need a lot of room because they are super hyperactive. Okay. Boom. Okay. That is 15. Now we're going to 16. Okay, what's up? Yeah. It is to keep the pH from going too low. So bicarbonate's a buffer, all right? Bicarbonate is the same thing as baking soda. So your body actually produces baking soda. Very interesting. So it keeps the carbonic acid from becoming too dangerous in the blood. So it keeps everything nice and normal. Chloride? They switch, yeah. So chlorine's going to kind of counteract it. So you have chlorine and you have bicarbonate in the blood. So when chlorine binds to a hydrogen, what do you make? HCl. Strong or weak? That's going to lower pH even more, right? So if your blood if your pH gets too high, your body will start making hydrochloric acid to counteract it. That's kind of what's going on there. Okay. But very rarely, what? Okay, go. Oh, we do have to talk about DGG, don't we? I kind of skipped it because we were going to mention that with because it's kind of weird to have it right here, the DGG. Where is DGG? DPG, because DPG we're talking about with the brain and stuff like that. So what's glycolysis? What's glycolysis, guys? To make what? Glucose. But red blood cells, they're zombies. What are they missing? So red blood cells, when they're born, they're a nice actual, like a spherical circle. And when they graduate blood school, we take a scooper and we scoop out the brain and the heart. So there's nice there's a nice curve. So when red blood cells perform glycolysis, right, they can only do glycolysis. So what's going to build up? Sugar, which they're going to use because they need to do normal functions, make proteins and stuff, right? But as a byproduct of glycolysis, what do you make? What's the end goal? Oh, what's the last thing you make in glycolysis cycle? Huh? You don't remember? Any of you guys remember? Oh no, we don't remember. What is the first step in the Krebs cycle? Pyruvate, guys. Make pyruvate. You make pyruvate. You gotta remember this for biochemistry. Make pyruvate. But they don't have mitochondria, right? Which means they can't do the Krebs cycle. So what's the pyruvate get converted into? No, acetyl-CoA is a second messenger. It gets converted into lactic acid. So they make lactic acid. So what this goes on is when red blood cells make a lot of lactic acid, they produce this thing called 2,3-DPG to kind of counteract it, right? basically what this means is red blood cells can make themselves acidic by making lactic acid. If red blood cells are more acidic, they can take in more oxygen. Does that make more sense? Because remember, if pH decreases, red blood cells become more tuned, have more affinity for oxygen than CO2. When pH increases, they have more affinity for CO2 than oxygen. Does this make sense? So basically what this 2,3-DPG is saying is red blood cells in a way can make themselves more tuned to oxygen. Higher 2,3-PG means they are more tuned. It means they are making more, they have more lactic acid inside of them. Make sense, Athena? Yeah? You're saying yeah, but you give me a weird confused look. Let me explain it a bit differently? Okay. Lactic acid. What is it? What's lactic acid? Is it a base or is it an acid? It's an acid. Is it going to increase pH or decrease pH? What? Okay, I thought you said increase for a second. We'll have a conversation with you. It's going to decrease pH. Going back here, oops. A decreased pH makes it have a higher affinity to oxygen. This 2,3-DPG, you can notice 2,3-diphosphate 2,3-diphosphate glycerate, right? Hey, glycerate. Glycerate. What does glycerate sound like? Huh? Sounds like pyruvate? Glycerate sounds like glucose to me, right? Glus, right? And hey, a phosphate. Hey. So basically what's going on is the red blood cell is making ATP in a way, right? 2,3 means it has diphosphate. It has two phosphates, right? There's two phosphates, diglycerate. This is basically lactic acid. So when lactic acid levels are high in the blood, it's going to cause a decrease in pH, which makes them more affinity to oxygen. Whoa. Misread that. Don't wait. Sorry, I misread that. Mm-hmm. Yeah. Yep. Yep. Cool. Good. More questions for me? You didn't submit a study guide, Athena. Why didn't you send me all the PowerPoints of the study guide? That would be nice. Huh? You didn't submit a study guide this time. Yeah, it's very nice to have the study guide, so I know your questions to be asked. It's all good, because I'm probably going over a lot of things you guys don't need to know. But it's fun to go over. Okay. The Bohr effect was for CO2. The Haldane effect is for oxygen. Hey, in the lungs, oxygen gets picked up, and then it dumps it off. Woohoo. That's pretty much it. So Bohr's and how CO2 works. Haldane's how oxygen works. We already know kind of how the oxygen works, right? We don't need to go in detail with it. Okay. Now we talk about this. I don't want this corgis up there. It's kind of weird. So breathing, voluntary or involuntary, or both? It's both. You can't control your breathing, and you can control your breathing at the same time, right? Hence, why? If someone ever says that drowning is the best way to die, tell them they're stupid. Because if you try forcing yourself to drown, your body is going to start gasping for air, and you will violently fight. Have you ever seen movies where someone dies, like suffocates someone? That's not how, it's very hard to suffocate someone, because the body will use all its strength it can to remove something so it can breathe. It will fight itself to survive, right? You go into fight or flight mode. Adrenaline starts pumping. People can lift cars when full of adrenaline. I'm pretty sure you can punch and push something off of you. It's very, very hard to suffocate someone, right? So anytime you see a movie where someone puts a pillow over someone, not hard. It's very, very hard to do. That only would really work with old people. So there, if you have ideas, go ahead. So the two areas of the brain that are going to help with breathing are the pons and the medulla oblongata. Going back to 201 or 210. What's the pons control? Rhythm or depth? Remember? So pons can control rhythm. Medulla oblongata controls depth. How I remember this is I always say medulla oblongata with a deeper voice. So I know it has a depth to it. Medulla oblongata, right? Pons is going to control rhythm, which means it controls how fast or how slow you breathe. Medulla controls how much air you inhale or exhale. Cool. So, medulla oblongata, I don't like something. What? Don't you dare tell me that's the exact opposite. Well, apparently I'm wrong, and Google was wrong. Medulla oblongata sets the pace, apparently. Stupid Google. Okay, medulla oblongata is going to set the pace. I am wrong. So medulla oblongata is going to set the pace. Stupid. They technically work together. They do the same thing. I hate the brainstem. It's the dumbest part of the brain to me. Makes no sense. Okay. So dorsal respiratory group, DRG. It's only going to cause breathing, inhalation. So you notice it's quiet and forced breathing. What's quiet breathing? Normal breathing. What's forced breathing? Gasping, or if you can hear the person you sit to breathe, that's not good. So if you guys, luckily you guys haven't done this yet because you haven't taken exams in person, but I always got unlucky and sat next to the person who was gasping for breath during an exam. It's very annoying. Also, with my luck, every time I fly, I always sit next to a person who's terrified of flying. And it's like they just start freaking out, and it causes me to freak out because I don't know what they're going to do. It's worked every single time I've flown. I've always sat next to someone who has almost like a mental breakdown while flying, which is very bad because I'm already a big guy in a small area next to a guy who's freaking out, who's invading my space. One person was freaking out so much, they literally started elbowing me in the face because they were trying to freak out because they wanted off the plane as the plane was ascending. So yeah, it was fun. Also, I like to get window seats because I like to look out the window, even though it's less room for me. But I can never open the window because they freak out when they see how big the sky is. So I like to look down. I love the feeling of looking down that weird pit in your stomach. I like that feeling. Other people don't. So, oh, fun fact, real quick. So you guys attention to that. That pit in your stomach, that's a natural response. If you go run up to an edge of a building, you can't force yourself to jump off. If you try running off the building, you literally will stop. Your brain stops you from continuing onwards. Try it. Well, with a guardrail, right? Try running, right? Your brain will cause you to stop and look over the edge before you continue onwards. It's a normal response you should have. Well, cliff jumping, you can overreact while your brain thinks, right? But with cliff jumping, usually you have to look over the edge first to clarify. You just can't just run over or just jump over a random edge, right? You can't do that. And if you do force yourself to do that, people have died of heart attacks. It's happened before. People have jumped off, friends have kidnapped them and took them on a helicopter ride and pushed them off the top, they're skydiving, and they jumped off a table that far and hit the ground, and they died of heart attacks. They thought they were falling because the brain doesn't know. The heart doesn't know. Your body's stupid. Okay. Back to this. Fun facts for Shane. Learn how to kill people. It's my forensic science degree. So dorsal respiratory group. So it's dorsal. is in the back of the front, back of the medulla. Ventral is going to be in the front. This is going to do respiratory, inhalation and exhalation, but only with forced breathing. So this is where you start gasping for air, is when that area gets lit up. So quiet breathing. Inhalation, it's usually breathe in for 2 seconds, breathe out for 3 seconds. That's going to be your DRG. If you start gasping for air, DRG stimulates VRG, which then causes you to start gasping for air and breathing faster. Pons, apparently it's the depth of it. And you have 2 centers. I'm not going to like how to say that word. I don't know. Apneustic, I think. Apneustic center, right? Which tells the DRG to work. DRG is just normal breathing, right? So apneustic works with DRG, so that way when you breathe quietly, it's not you're not gasping for breath as breathing normally. It's normal inhalation exhalation. All right? The pneumotax center stops the apneustic center. So basically, can I get my mouse back, please? There we go. This guy stops this guy from occurring, so that way this controls making sure you breathe normally. So now you're just gasping for breath. So if a patient is just sitting there and is just breathing at a normal pace, but is doing this, something's wrong with this center of the brain. And if something's wrong with the brainstem, usually something bad happened to that person, because the brainstem is very, very hard to hurt. Why is that? The base of the neck. How many injuries happen back here? Not a lot of injuries happen to the base of the spine, or base of the spinal cord, base of the brain stem. Okay. So you think about it, the apneustic center is inhibitor, and that inhibits the inhibitor. Cool. Okay. So what cranial nerves are these guys right here? 9 and 10. So you guys at least know what 10 is, right? What's cranial nerve number 10? Vagus or vagus, right? Everyone loves vagus. So the vagus nerve is going to control a lot of our breathing, because it's a lot of the parasympathetic function, right? So if you mention cranial nerves, especially number 10, that's going to mean you're going to decrease breathing. Cool. What's really interesting is you have stretch receptors in the muscles around your ribs. Why would you have stretch receptors there? Also in your diaphragm. Why would you have stretch receptors in there? Breathing. If I could breathe in enough air, right? So you try breathing a lot of air, it starts hurting. It's because you're activating these stretch receptors saying, hey, you breathe enough, exhale this air, don't keep on breathing in. Make sense? And that's why the stretch receptors go activate cranial nerve number 10, which then tells the lungs to chill out, which forces you to breathe. Okay. So, chemoreceptors. What do chemoreceptors measure? What? What chemicals? Cool. Mainly when actually oxygen, carbon dioxide. For this exam, we're focusing more on oxygen, because oxygen is a bit more important than CO2, right? So, if chemoreceptors are activated, you're going to start breathing, start gasping for air. And you can see that because each one is saying it's going to be stimulated by a change in O2 or pH. Okay, boom. Why would they be connected to our coronary arteries? Where the cortical arteries go to? Cortical? Coracoid arteries go. You're correct the first time. Goes to the brain, right? What's your brain want? Good blood or bad blood? Good blood. That's what's going on there. That makes some sense? Okay. Okay. Almost done with the lungs. Thank God. A lot of the lungs is it's repetition. So, hypercapnemia. This means you have too much CO2 in your blood. Is your blood going to be acidic or basic? Low pH or high pH? Low pH. You're good. That's why I asked this question. So, you guys ever heard of hyperventilation? Hyperventilation is what? What you guys do during exams, right? Start panicking, start gasping for air. Ever heard of hypoventilation? It's the exact opposite. It's when you don't breathe. So I experience hypoventilation. Well, I've seen more hypoventilation than hyperventilation. When I worked with cadavers and gave tours to cadavers to people, what happens is people lock their legs and stop breathing. If you lock your legs and stop breathing, you pass out. So hypoventilation can lead to passing out, which means they're not breathing. Hyperventilation means you start, right? You start breathing out all your CO2 and breathing a lot of oxygen. Is that bad? Balance, right? You want a nice balance between CO2 and oxygen. If your chemoreceptors detect too much or too little CO2, they're going to tell your lungs to either breathe less or breathe more. Okay. So hyperventilation can cause numbness or tingling in the hands, the feet, the lips, lightheadedness, dizziness, headaches, chest pains, flexor spasms of the hands and feet, and slurred speech, and sometimes fainting. Which I think is hilarious because if you experience these symptoms, what do you do more? You hyperventilate. Hyperventilation is a weird cycle because when you start hyperventilating, you start feeling the symptoms of hyperventilating, you start freaking out even more, which causes more hyperventilation. Okay. This makes sense, yes or no? What's up, Athena? You had a weird, you asked me a question? What? What's up?
Well, okay, so the central chemoreceptors in the liver respond to CO2.
Yes.
So if CO2 is high, then for example, the rate of decrease.
If CO2 is high, right? What does that mean? If CO2 is high, is the person breathing, yes or no? No. So how do you get all the CO2 out of the body? You're going to increase pace and increase depth, right? You're going to try forcing as much oxygen into the system as possible to counteract that. Does that make sense?
Yeah. So then for the peripheral ones, those respond to oxygen.
Yes.
So if the oxygen is low, then the depth and rate will increase
Yes.
because of the oxygen.
Yes.
So say, like, it would be the same with CO2 if it's high.
Yes. Exactly. With those ones, just stop. Think about you want high oxygen, low CO2 normally in a given state. You won't be one, but in the same measurement. In your exam though, if it mentions low or high or something, it means you're out of balance. So we're not going to throw numbers at you guys. Okay. Emphysema, also called COPD. So these are pink puffers, right? Can I talk about? I'll talk about this later. Talk about it now. Well, go back. This dinosaur creeps me to freak out. I don't know why. I'll talk about it in a little bit. Okay. The alveoli sacs, they can't compress. So they're always inflated. So you see these gigantic holes in the lungs. It's going to cause the lung to breathe in more air, right? But can't breathe it out because you can't force the CO2 out of the lungs. Does it make sense? As much as I hate the dinosaur, these are the best pictures to look up online looking for diseases because you either learn by the pictures or the words. So this person has a barrel chest, which means their chest cavity is almost always bigger, almost like always inflating. right? Because when you breathe in, people's chests get bigger, correct? Okay. Up next, really, their lips purse. Their lips actually inflate and are very, very pink color, which is really weird. Emphysema has been caused by what? Smoking. Not nicotine, it's smoking. Smoking's bad, nicotine's depending on things. So the lips are like this when you breathe. That's kind of weird, right? It is. It's exaggerated, but when you breathe normally, your lips don't flare up. So if you look at someone breathing, if their lips flare up when they get purse, it means they're sucking in more air to try to breathe it out too. It's really weird. Okay. Any of these words? Let's see. Thin appearance. So he looks super thin, i.e. my grandpa, because he has this. If you're using your skeletal, your intercostal muscles to initiate breathing, that's bad. It's the diaphragm that should do 95% of the job. Intercostal muscles help a little bit, right? People with emphysema, they're using a lot of their intercostal muscles, right? So what are they going to complain of? Chest pain. Because if you work on a muscle you don't normally work out, right? It's going to get inflamed for the first time. There you go. Barrel chested. They have a quick inhale and this huge exhale. So they're almost like they're sighing a lot. Other things that's interesting. Oh, here. This is actually kind of cool. So if you can walk to this person, but like with a for the thing's called, you put the ear to check heart rate. You check the back of the lung and you tap on it. It sounds hollow, which is really interesting because the air is full of lungs. Thus, it's actually hollow. Very interesting. You probably don't need all this, know all this. I just like talking about the diseases. So if you have emphysema, it means they're going to have giant alveoli sacs and they can breathe in easily, but breathe out hard. I have this old man right here, barrel chested. Looks too much like my grandpa. It's scary. Okay. So, perfect person, never smoked in their life. Hey, if you smoked and then stopped smoking, you can actually get lung function back. The problem is, even if you're old and you stop smoking, you'll get lung function back. That's kind of cool, isn't it? Smoking bad. Okay. Bronchitis. What's that mean? What's the word bronch? What pops in your head when I say the word bronch? Bronchioles. What's itis mean? So, and what's inflamed? The bronchioles. And what's chronic mean? Long-term or forever. This is long-term inflammation of the bronchioles. Not good. So you're asking why is it not good and why they show this picture right here. Look at the lungs. Do you see little white specks in them? Remember the other picture I showed? The lung was nice and dark. Little white, tiny little specks, right? That's mucus. It's a lot of mucus filling up the lungs. It's not gigantic. It's not a big problem, right, with this person. But hey, if the mucus gets further and further into the lungs, what can it cause? If mucus gets into the alveoli sacs. Pneumonia. Is pneumonia dangerous? Yes. So bronchitis can lead to that. Lung cancer. Very, 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 very dangerous. 1/3 of all cancer deaths is lung cancer. So, squamous cell carcinoma. So basically, the bronchial will start getting tumors and be very cancerous. That bad. Because what's a tumor? Okay. So here's my analogy. Cancer is just your cell having a temper tantrum. So you guys ever babysit kids before? What do kids not want to do at night? Go to sleep. So what do they start doing? Temper tantrum, right? They don't start listening to any of the rules. Cancer is when cells don't stop multiplying. They start doing weird random functions, making weird proteins. And they don't want to listen to apoptosis. So they continue growing, they start making weird proteins, and they don't want to die, right? So what's going on is you start growing this massive tumor or massive growth. Do you want a massive growth in your lungs? In your bronchioles? Why not? Can't breathe, right? It's a blockage. It's a blockage, random thing right there. That's bad. Again, smoking can cause cancer. Links are there. Okay. The most common is going to be squamous. The least common but most dangerous is called oat cell. That's what this picture right here is showing. Normally, it might cause little tiny bumps. Oat cell causes like oats. You guys ever seen oats before? Like horse feed? Like they're massive. They have to feed horse, right? These massive growths in the lungs. Very, very bad because they can metastasize easily, which means they turn dangerous and start causing blockage. Okay. Look at all this right here. That's useless. That's useless. Very, very bad. Okay. And any more questions on the lungs for me? Most likely, most of the tests will be on lung stuff, respiratory system. Don't give me that look, because digestive is easy. Because it's very simple. Watch, it's very straightforward. We can finish digestive in like a couple seconds. I was scared because I thought I wasn't recording for a second. Like, oh God, no. But I am. Cool. So here's all your digestive system. First off, digestive starts where? Mouth. Cool. Then it goes where? In the esophagus. Then goes where? Then it goes where? Then it goes where? Then it goes where? You poop it out. So, digestive system, internal, external. External. It's weird. If I took a piece of yarn and I ate it in this gigantic yarn ball, right? It would pass through my entire system, right? And still be connected to the yarn outside. That doesn't cross any barriers, right? So your entire digestive system is considered an external organ system. Same thing with the lungs. And same thing with what other system? Skin, true. Also about reproductive organs. They're also considered external organs. Because there's no membrane you have to cross. Does that make sense? Okay. So first up, ingestion, which means you eat food, enter mouth. Next up, mechanical processing, which means you chew. What's chewing called? Mastication. Now, if you're at a party full of drunk people and start talking about mastication, it's hilarious because they don't know what they think you're saying other word besides mastication. Very fun word to say. I like that word. Okay. Digestion means what? Breaking down. Am I absorbing food with digestion? No. Secretion. What are you secreting? Enzymes that help with what? Digestion. Absorption. This is where you're absorbing things. Lastly, excretion. Please tell me none of you guys do this. Especially this one. Like, what is going on? Like, I can understand maybe this one or something, like popping your back or stretching your arms. But, like, no, that's weird. When would you have room to do this? Like this one right here, this person's in pain. I can see that, like you're in pain, you're leaning over, like he really has to go. But like, if I ever saw someone do this, I would just never try that person ever again. I don't know why. Okay. Mastication, you're going to crunch and eat your food. What jaw muscle, well, sorry, first off, what bone causes mastication? The jaw. What bone is this? Mandible is the only movable part of your skull, right? Good. So your mandible, and what muscles cause your jaw to move? What? Master, right? Mastication, master. So it's a master muscle. So you're gonna help chew. Cool. Up next, salivary glands. We have 3 key ones. We have submandibular. So what's sub mean? The mandible. Where's the mandible located? Right? So back here, it's the biggest one because it does the most things. It is 70% of the work. Then you have, well, technically it's not the biggest one because right here, these are technically bigger depending on the person. The cadaver I had, this guy was huge for some reason. But submandibular, your parietal, can't say words. Protroids, salivary gland, parathyroid, parotid, there we go. Parotid salivary glands. And then you have your sublingual. What's that mean? Below the tongue. Good. So this guy right here will do a lot of the enzymes. Same thing with the parietals. Sublingual will just mean a lot of lubrication, basically. Okay, first up, parietals. They're going to make amylase. You need to know what amylase does. What does amylase do? Carbohydrate, carbs. What do carbs get broken down into? Sugar. Good job. You do have to know the duct, unfortunately. The Stenson duct is for amylase. The reason being, what happens to the Stenson duct is okay. What happens to the Stenson duct is blocked. What's going to happen? You can secrete it. You just can't get rid of it. You can't empty it. The Stenson duct is where things drain into. That's bad. Because where's all the excess saliva going to go? In your mouth. Excess saliva is bad. Sublingual. It's going to make a buffer and kind of a lubricant. Basically, I would mainly know the lubricant. And then the rivus. Rivus? I don't know. Some weird person made this one up. Huh? Rivinus? Ah.
She said that we don't need to know the ducts.
Okay, then you don't need to know ducts. Thank you for telling me. Then don't know the ducts then. So, what? Do you need ducts?
Oh, I would assume not.
Okay. Never mind then. I would be a mean teacher because mandibular. You're gonna make this thing right here called glycoproteins, mucinous. What is that? That's the lubricant, mainly. It's gonna be the main lubricant for glycoproteins. And more amylase. Hey, what does saliva help break down most of? Carbs. Because amylase for parietals and for submandibular. So, what saliva is mainly going to help with is amylase. Why? How important is sugar in our body? Very important. So once we start breaking that stuff down, immediately. Does that make sense? That's why if you take a piece of bread, put it to your mouth, it actually will start dissolving in your mouth. You keep it in your mouth long enough, it actually will break down fully. It's a weird experiment Dr. Wyman would do in front of the class. He gave me a cracker and told me a saltine cracker, told me to chew on it without swallowing it. It literally gets smaller and smaller in your mouth the longer it's in your mouth. It's disgusting because it starts turning into chyme in your mouth. Yeah, it's weird. You don't think about it. When the food you swallow, it's really weird. So saliva is mainly water. This baby's weird. I don't like it. Look at him. He's not happy baby. What? I love babies. I love babies. Well, that's when they're inside the womb, and it's not my kid. I love other people's kids. I love toddlers more than babies because you actually can talk and make toddlers do things. Babies are just going to cry and poop and pee and do nothing. They're cute. I love them, but I know my brain's going, I can't kill that thing because it's cute and adorable and I have to protect it. Brain chemistry. It's what it is. It's a parasite. It's causing you to not want to kill it. That's what parasites do. There's literally a parasite that infects crabs, which makes it care for the parasite egg sac like it's its own egg sac. Yeah. Yeah. It's a parasite. This is all part of evolution. So we don't kill them. Because in reality, babies are super annoying, aren't they? No? You don't think so? When a baby cries, what's your first reaction? Make the baby stop crying, right? You don't punch the baby. You fear the baby and make it stop crying. That is evolution making you go, oh no, member species is dying or is hurt. Fix it out. What's your question? What? What is? Yeah? Yes, it does. A little bit. Okay. It's full of everything else, though. Hey, we really mention it here. Why would you have antibodies in your mouth? Bacteria. Why would bacteria be inside your mouth? Because you're eating food. Or you have this thing. These things put things in their mouth all the time, right? Again, I'll bring it back to there. It makes you guys laugh. So first function of saliva is to lubricate your mouth. Why? Because dry mouth sucks. If your mouth is dry, you try eating food, what happens? If I eat a tortilla chip, my mouth is dry, it's gonna start cutting my mouth, right? So it makes it really hard. Also, it moistens the food in my mouth, makes it easier to chew. So again, like a tortilla chip, makes it less hard, makes it more soggy, fun. It then has chemicals that break down the food. Also, what it does is when saliva starts hitting your stomach, it tells it to start going. That make sense? So technically digestion does start in your mouth, but in reality it starts with your eyes. You can start salivating before you eat food. Because you have to, right? Because you want your mouth nice and wet before you eat food. Haha. As in Pavlov's dog, which is a conditioned response. So when you see the burger or the Chick-fil-A sandwich or whatever food you find appealing, you start salivating. Salivation, is it part of the sympathetic or parasympathetic? Para, why? Rest and digest. So most of the time when we're talking about a nervous system with digestion, what nervous system we're talking about? Parasympathetic. If your sympathetic gets activated during digestion, you stop. Hence why if you eat food and exercise immediately after eating, what do? You vomit. Because your body's like, no, not right now. We're running for our life because exercise is scary. Okay, so I know you guys are in high school, but people could do this. It's called gleeking. If you press on your sublingual salivary glands, you can shoot saliva out. Snakes can do this with the parietal glands, but that's where they make venom. Kind of cool, I think. This is disgusting, though. This is cool because, yeah. Because only guys will do this. I've never seen a girl do this before. I've only seen guys do it. Girls can do it, but it's disgusting. And guys are disgusting. Yeah. I'm a guy. I know.
Can't you accidentally do it?
You can, yes, you can accidentally do it if you press down your tongue hard enough, yes. You can accidentally do it. Okay. So halitosis is bad breath. So you can clinically be diagnosed with bad breath. Look at these beautiful things right here. This is why I'll never be a dentist. I could be, because the mouth is interesting to me. But it's the fact that, also the same thing, I couldn't be a foot doctor or podiatrist, because 95% of people don't take care of their mouth and don't take care of their feet. So if you're a dentist, do people like dentists? Do you guys like going to the dentist? You're weird. But also, you have free health care where you come from, so it's easier for you. It's a lot of money. But also, you go to the dentist, you don't like it. So when people go to the dentist, they go for the worst case ever. So people's teeth look like this. Imagine digging around with there. Bad, right? Same thing with a podiatrist. When do you go see a foot doctor? When your foot's messed up, right? You start seeing weird gangrenous or diabetic cases of it. Very weird. Okay. So what causes bad breath is bacteria growth is there inside the saliva or inside the tooth cavity. You have worse breath in the morning breath, because your mouth is dry. If you start making saliva, the antibacteria in the saliva will start killing all the excess bacteria, and your breath might get nice and clean, might be cleaner. If you eat garlic or onions, the protein that makes garlic and onions smell actually gets absorbed into your blood and then into your lungs, and then you breathe it out. Very interesting. Cool. Hence, it also goes in your blood and your sweat glands, because when you start eating garlic and onions, you start sweating it out too. Eat a clove of garlic and then start working out. You actually can smell garlic from your sweat. Yeah, it's weird. Welcome to my Italian grandpa when I was younger. He would eat cloves of garlic, legit just random cloves of garlic. He would just eat it. It was weird. I like garlic, but like not a clove by itself. He would peel it and eat it. It's weird. Okay. So we have pacemaker and then pace setter. So pacemaker is for what organ? Pace setter is for all the digestive. This pace setter causes a motion called peristalsis. This motion is very hard for students to understand, but basically the top closes and it moves the thing down slowly. You can feel this sometimes in your stomach. You can kind of feel the food moving. You can feel part of your stomach kind of constricting and then moving the food down slowly. This is peristalsis movement. The reason your digestive system does this is because this is very passive, because it just does it once and it goes all the way down, moves the food, boom. When food is all this nice blob and kind, it's called a bolus. Don't know why, it just is. Okay. So peristaltic thing happens in the esophagus, the stomach, the small, and the large intestine. The large intestine is a bit different. Instead of being a nice, smooth, pushing down motion, it's more of a circular motion because it starts cutting up the chyme. Make sense? Hence, when you poop, it's not one single giant log. It's in bits and pieces sometimes. That makes sense? Cool. Be weird.
You say the difference between bolus and chyme?
It depends on where it's located. Usually bolus is going to be in the esophagus before it gets to the stomach. After the stomach comes chyme. Make sense or no?
Yeah.
Okay. Esophagus. Pretty much same thing as trachea. Only difference is it's got these things called sphincters. What's a sphincter? It's a door. It's closed, right? What's the most common sphincter you guys know about? You look at every time you look at a cat's butt, you should see a sphincter. The anus is a sphincter, right? It is a closed thing that can open. You have sphincters all through the digestive system. Why? What? Food doesn't go back out. That's one reason. Also, it's so we can process food, certain food at a given time, right? Because does food come back out of the mouth sometimes? Yeah. So sphincters aren't perfect, right? They're not. They help a lot, but you're correct. It's to prevent some backflow, and it's for the processed food as it goes down. Okay. So peristalsis is very interesting. There are two waves. Primary wave, which you show right here, which is basically the top contracts and it slowly contracts the bottom and it slowly pushes the entire thing down. There is a secondary wave. And what the secondary wave is, after it contracts, it kind of relaxes a bit and then it contracts again. That secondary wave of motion helps get food gets blocked. Food gets blocked pretty easily if your throat is dry. Right? Have you guys ever seen thick water before? You guys know what thick water is? You guys know what thick water is? Oh, thick water is awesome. Yes, old people have it. So thick water is water that's thick. Yes, I know, it's cool. It's gross, don't drink it. I've done it on a dare. Thick water. It's thick water. First off, old people, their salivary glands are less efficient, which means their mouth is drier. And since that's occurred, also their muscles are weaker because they're old. So a lot of the motion to move things in their mouth is hard. So swallowing is a very hard function for them. So it's easier for them to swallow a thick thing like this, because when you swallow a little bit of thick water, it kind of pulls more of it down with it. It's very interesting. Don't drink it. It's like Jell-O. Or try it. I don't know. You might like it, I guess. I don't know. Okay. Yay! So, swallowing, also referred to as deglution, can be initiated voluntarily. Can you swallow involuntarily? No? Ever get a dog? Ever like put a pill in someone's mouth and you see people go like this? You can cause someone to swallow. If there's something in your mouth, you will swallow. You spit it out or swallow. There's two options, right? If you massage the throat, it will cause it to go down. Once the tongue pushes back, right, and the swallowing occurs, everything else is out of your control. That makes sense? Cool. You have three phases: buccal, pharyngeal, and then esophageal. So the buccal phase is right when you push it back with your tongue. So what happens here is the soft palate closes. Why does your soft palate close? What's the soft palate do? Does it go up? Food should not go through your nose. Make sense? When you vomit, you're forcing all the stuff in your stomach out through a lot of pressure, right? That's when you throw up. It also goes through your nose as well, because you actually are going it so quickly, it bypasses your soft palate. Also, body's dumb. Your soft palate only closes when you're swallowing, not when something comes back up. Yeah, that's why it also comes out your nose. So your soft palate closes, so food can't go up into your sinuses and your nose. Next up, well, technically it's first thing. I think it's the only thing going on right there is technically it closes your soft palate and it's ready to go down. Next up, pharyngeal. Epiglottis closes, passes your epiglottis. Now it's in your esophagus, gets pushed down. That's pretty much it. That make sense? Cool. Can you eat and breathe at the same time? Yes or no? No. What takes priority, eating or breathing? Breathing. This is why when you try eating while talking, you would choke easier, because your epiglottis doesn't know what to do. Okay. And then finally, the bolus enters your stomach. Yay! Epiglottis closes the tube. You have an upper esophageal sphincter and a lower esophageal sphincter. Can you physically control these sphincters, yes or no? So there's like three sphincters in the body you can control. One of them is your anus. You can physically control your anus. Good. Because you can stop yourself from pooping. Or you can stop yourself pooping mid-pooping or before pooping. It's weird. We'll talk about pooping a little bit. Okay. But any other sphincters you can't control. I got any questions with that one? What's up? What? The bladder is one. And there's, I think, one more, and it's a weird one. It's, I forget where, but it's around your rectum too. It's one leading to your rectum. But most of the time, you can't control your sphincters. Okay. Heartburn. What's heartburn? Acid goes where? Up where? Your esophagus. What are some causes of heartburn? You guys ever get heartburn before? No? You're lucky. Good. What can cause heartburn? Eating too much. Why would eating too much cause heartburn? What's inside your stomach right now? Stomach acid. So if I eat a lot of food, right? Kind of like throwing rocks in a pond, water goes higher and higher and higher. So the more food I have, the more stomach acid I need to make, the more the acid moves up. If the acid starts going past this lower esophageal sphincter in my esophagus, it burns it. Another thing that can cause it, eating spicy food. Because eating spicy food actually causes you to make more stomach acid, which then goes up. Last way of doing it is if you eat and then lay down, take a nap immediately afterwards. It's because you're laying down, it's easier to get up in the esophageal sphincter than sitting up. Make sense? Okay. I don't know why this guy looks like Hitler to me. Doesn't he? I just noticed it. He just looks like Hitler. It looks like a mustache right there. It's a shadow, but it looks like Hitler. Which makes this even worse. Oh no, that's bad. Okay. Heartburn, good thing or bad thing? Yeah, you got my joke now, didn't you? Yeah. So look at the picture with the fire. There we go, you got it now. Okay. So, what type of tissue is found in your esophagus? Stratified squamous. What type of tissue is found inside your stomach? What? Simple columnar with what type of other modified cells? Goblet cells. They have goblet cells to make mucus, right? The reason you have goblet cells inside your stomach is to fight against stomach acid. Your body is dumb, but also kind of smart. If you keep on getting heartburn over and over and over and over and over again, what happens is your esophagus goes, I'm done. It starts turning the esophagus into stomach acid, into stomach tissue. That is called metaplasia. You guys have heard this word before. Plus morphosis in it. Metamorphosis. Meta means changing in something. So metaplasia means changing of cells into something else. So one type of cell turns into a different type of cell. Or tissue, one tissue turns into a different type of tissue. That makes sense? Here's an issue though. Your esophagus is simple stratified columnar, simple columnar for a reason. If tissues start changing, higher risk of cancer can occur. When you have chronic heartburn, it leads to something called Barrett's esophagus or Barrett's esophageal cancer, or referred to as GERD before. You start burning your esophagus, it starts becoming less esophagously. So very, very interesting. Okay. Segmentation. What's segmentation mean? You guys know? Food, food, food. You're slowly segmenting the food and pushing it down slowly, right? That's peristalsis. My bad. That's peristalsis. Segmentation happens in your large intestine. It starts breaking it down to segments. Why would you want to do that? This happens in your large intestine, also in your small intestine. Absorption, right? Increased surface area. So I start throwing enzymes at him, has a higher chance of activating, interacting with these particles, right? Hence, also why your poop is weird. It's contractions in random ways. See this, like this contracts here, it breaks up the food in random ways. Cool. So, yep. So technically, anytime it's peristalsis, it is a motor neuron. It's just involuntary motor neurons. So, what is going on here? This is the stomach. So you can see the stomach has what? What's this big red thing right here? Muscle. So can the stomach expand and contract? Yeah. The stomach can also kind of do some mechanical breakdown itself as well. Not very well, but it can. And that's what I was trying to say. is that there is these nerve plexuses that causing muscle contraction and muscle movement going on. They break down way too much, but basically your muscles can contract and cause things to occur. Yeah. Here's what talk about some hormones. A lot of these you don't have to know. This picture's a really bad picture. Just shows a lot of them. What? All of them? All but two? Okay. These ones? These ones are here? So you guys know everything else then? Okay. Well, these ones should make sense. Amylin sounds like what else? Amylase. So what's it going to break down? Gastrin makes gas. So you have stomach gas, right? It's going to help make stomach acid. That's what gastrin's going to do. Ghrelin, I think that's how you say it, is going to help make hunger. This tells you you're hungry. It's the hunger hormone. So when you start getting like a rumbling in your stomach, right? That's that hormone telling you guys to eat. Secretion tells your pancreas to start doing what? Secreting things, right? Secretion tells other things to start secreting. GIP starts interaction, not interaction, bad word, dimethyl. We'll talk about that one a little bit. Motrin I'll talk about, and then we'll talk about this one a little bit too. Okay. Let's talk about it in pancreas. It helps secrete other things too. It's gonna make the pancreas start working to do things. Because pancreas secretes two specific hormones besides insulin and glucagon. Because insulin and glucagon, are those going to be internal or endocrine or exocrine? Insulin, is it go into your blood or into your stomach? Someone said it. Insulin, is it in your blood or in your stomach? It's in your blood, which means, is it on the outside or the inside of the body? It's endocrine. It's a hormone. When the pancreas starts releasing something like amylase or like some proteinase, right? That's considered exocrine. All these digestive organs, all these digestive hormones are exocrine because technically they're secreting it into an outside source because your stomach's outside your body. That make sense?
Do you think we have to know which ones are endocrine and exocrine?
So far, I'll tell you which one when they come up. But so far, the ones I'm seeing up here are going to be endocrine or insulin and glucagon. The rest are going to be exocrine. Actually, this one right here might also be endocrine as well. Because it has to tell your brain you're hungry. Okay. So, how do you guys think you say this? How do you think you say this word? Peritoneum. Welcome to the newest organ discovered in the body. Peritoneum is an organ now. You have parietal and visceral. So again, what's visceral mean? Parietal, outside source. You don't see these in the cadavers. We remove the peritoneum for a reason. If you cut me open right now, you'll see a sac containing all my digestive organs and my kidneys. It separates the digestive organs from the rest of my body. The digestive organs and the kidneys. Why? Why do I want my digestive organs and my kidneys to interact with the rest of my body? What's inside your large intestine? What's inside your large intestine, guys? Poop. Your colon. There's poop. Do you want poop inside your blood? Do you want poop touching your lungs and heart? Do you want urine touching your lungs and heart? The peritoneum sac gets all the disgusting organs and keeps them away from all the good organs. Does that make sense? That's how that works. And also, yeah, what's up?
So, sorry, not for the 9.6,
Which one? This one here? This is basically going to be the nerves that tells the intestines what to do. The reason it's special is because the intestines are autonomic organs that are constantly going off at a given time. Does that make sense? That's why they're special. You better say mastication at dinner, Madison, and talk about how food passes through. Okay. What's up, Athena?
it's the velocipede fuel that they
Yep. Why glossopharyngeal? What's that cranial nerve do? That's the back 2/3 of the mouth. Why is that important for digestion? When you swallow, that moves the tongue upwards. That pushes the food down your esophageal. And then vagus nerve does everything else that's parasympathetic. Does that make sense? That's why it's those two cranial nerves. Yeah. Okay. You leaving too? It's all good. I'll send you the video later. Okay. Mm-hmm.
This other question is, what is the significance that the buckets and the canal are located in the submucosal layer? Is that because that's what the processes?
So say it again.
It says what significance is it that the blood vessels of the alimentary
Mm-hmm.
canal are located in the submucosal layer?
Okay. What's this right here? So lumen. What's a lumen? Inside of something, right? Not a blood vessel, any type of tube in the body. So let's say I have a bunch of glucose molecules in there. Where do you want your blood cells? On the mucal layer, out here, or the submucal layer, closer to the lumen? Where do you want them? The blood, the arteries and capillaries and all that stuff. Where do you want them? Closer to the lumen or farther away from the lumen? Why? If blood supply is closer to the lumen, can it absorb things easier? That's why it's important that they're in the submucal layer, is so that it can absorb things easier. That makes sense? That's why. Okay. Ready? Okay. They talk. Does the study guide talk about the short reflexes and long reflexes of the digestive system at all, or no? Okay, then we're. Okay. So, what the short reflexes are is basically going to be, I eat food. That causes the top of my larynx, the top of my esophagus to contract, right? Which causes the next part to contract. Causes the next part to contract. These are short distances that cause short reflexes. Make sense? So these are very, 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 very close together reflexes that occur. For example, when food enters my duodenum, my first part of my small intestine, or a contraction there is only going to affect those one things, right? Long term or high, these are when I start squeezing out enzymes and all this other stuff ahead of time. Does that make sense? So short term is like things that happen now. Longer, these long term, large scale things. Yes, CNS is involved. Yep. You also can cause large peristaltic movements, right? So when would you need a big, large scale peristaltic movement? Something gets blocked off, start coughing, right? Or you need to squeeze something out of something. You try to force yourself to pass bowel movements, right? You physically force yourself to contract. There you go. Okay. Stomach. More of anatomy stuff, but you could be asked. Large curve, little curve. You have to know these parts though. Cardia, up here. How I remember heartburn is the cardia of the stomach has to be attacked. That's why it's called heartburn, because you're burning the cardium of the heart. Fundus, going to be around this part of the lung, this part of the stomach. The body, main part of it, and the pyloric side. I would mainly know the cardia, the body, the pyloric part, the fundus a little bit, but the pyloric part is the most important part. Why is that? Why is the end of the stomach the most important part of the stomach? Yep, because the pyloric side has this pyloric sphincter, which leads into the duodenum or duodenum. Make some sense? Okay. Ooh, rugae. So if you look at a stomach, it actually looks like this. So you guys ever eat cow stomach before? Cow stomach before? Menudo. Yep, menudo. It's actually pretty good. As long as you don't know what it is, it's good. The only part with menudo is it's chewy because it's stomach. But it's really, really good as long as you don't know what it is. Same with haggis. You guys ever had haggis before? It's stomach and it's sheep intestines filled with like spices and stuff. Yeah. I like eating weird food, but the problem is I like eating weird food and I know it's weird, not weird food. I mean, because if you know what it is, you instantly go type of thing, right? But if you don't know what it is, it's good, and it has to be good because people eat it. I mean, like cow tongue's probably really good. I would just eat cow tongue if I didn't know what it was. I mean, I can't just go cook a grilled cow tongue and eat it. That would just gross me out. I mean, I could on a dare, but consciously no. Okay. Stomach has 4 functions. We store ingested food. We help break down the food. We start jumping chemicals, and we produce intrinsic factors. Did I mention absorption at all? Does the stomach absorb food? Yes or no? No. Stomach does not absorb food. All the stomach is a giant bowl of acid. Okay. So the 2 big parts of the stomach are going to be 3 and 4. So what chemical helps break down a lot of the stuff in the stomach? What chemical? What's stomach acid made out of? Not gastrin. HCl, hydrochloric acid, stomach acid. That's the main acid going to break things down, right? We're also going to make pepsin, which is also going to help break down protein. Good. Intrinsic factor. What's intrinsic factor? What's intrinsic factor used for, guys? Last exam. Some blood. Last exam was blood, wasn't it? You talking about intrinsic factor? Intrinsic factor is vitamin B12. And vitamin B12 was what makes red blood cells. If you don't have enough vitamin B12, you can't make red blood cells. You start making precious anemia. Vegans have precious anemia because they need to eat protein, to get it from protein. So this is what's going on. That's why stomach's very important. It helps make vitamin B12. Now, do you need your stomach to survive, yes or no? No. You can live without your stomach. You just can't eat big food. Eat little food. Okay. So we have 2 types of major, we have technically 3 cells in the stomach. And those are parietal cells, G cells, and chief cells. We also have these things called D cells, but those work in conjunction with G cells. Okay, so parietal cells release what? HCl and a little bit of intrinsic factor. If you don't have intrinsic factor, red blood cells die. So Parietal cells make the hydrochloric acid. What do chief cells make? They make pepsinogen. What's the gin part mean? What? Well, yeah, but what does gin mean in Latin? Like Genesis? Beginning, right? So this is the beginning of pepsin. So pepsin is inactive until it comes in contact with hydrochloric acid. When it comes to hydrochloric acid, it becomes pepsin, which sounds like what? What does pepsin sound like? Pepsi. If you have access to cheap meat and have a can of Pepsi, get the bowl, get a bowl of cheap meat, dump the Pepsi on it, come back a week or two later, it actually breaks it apart. Yeah, they use Pepsi and Coke to clean the roadways from like crime scenes. You can use Pepsi and Coke to clean away blood and stuff. And you drink that stuff. So it's interesting. So pepsinogen or pepsin helps break down protein. So where does protein start getting broken down into? In your stomach, right? So you don't start breaking down protein in your mouth, it starts being broken down into the stomach area. Okay. G cells produce gastrin. Gastrin stimulates parietal cells. It gets the gases going. Gas, hydrochloric acid. D cells are going to make somatostatin. Somatostatin is what? Huh? Growth inhibitor hormone. So when you're growing, you have to eat a lot of food. If you're not growing, you have to eat a lot of food. If you're not growing, you still do, yes, but you eat less food, right? Somatostatin is going to cause you to stop growing, that you need less calories, so that you inhibit gastrin. This makes sense? Okay. So, phases of gastric secretion. Cephalic, gastric, and intestinal. And then it breaks apart right there for some reason. It's so weird. We are on 19, I'm at 20. Cool. Cephalic phase. This is when you see, smell, taste, or think of food. You start salivating. All that saliva starts going down to your stomach, right? Yes, what's up? Oh, purple pill, yeah. Yeah, I know. Okay. Hydrochloric acid, strong or weak? So what's that mean? So it's 100%, right? So hydrochloric acid becomes this plus this. What is this guy right here called? What's a charged hydrogen called? A proton. I pump protons into my stomach, into my parietal cells to make hydrochloric acid, right? So hydrochloric acid is made, broken apart because it reacts instantly, right? And then it's recycled back into the parietal cells and pumped back out. Does that make sense? So what these purple PPI, proton inhibitor pumps do, they stop you from being able to pump those back out into the stomach. Effectively doing what? If I can't push out hydrochloric acid on my parietal cells, can I make stomach acid? Effectively, what happens? I stop my digestion happening. Why would you want to stop digestion? If it upsets stomach, right? If I have a stomach ulcer or a heartburn, I can stop the acid from being formed, right? Because if you have heartburn, it means you already have acid all the way up to your cardiac sphincter, right? Do you need any more acid? No. So you can stop the acid from coming back out temporarily. That makes sense? Yep. It basically stops hydrochloric acid from coming out of the parietal cells. You stop bleeding? Good. Okay. All good? Cool. Okay. If you have more questions, let me know. Because I mean, if they're being mentioned on the study guide, they're probably important. Cephalic phase. So you start like salivating. This is going to cause your stomach to go, hey, food's coming, right? Because again, your body's dumb. If you think about food, your stomach starts grumbling because it wants food. It's already making the stomach acid, right? So it's going to start making the parietal cells start releasing hydrochloric acid. Pepsinogen gets released from the chief cells, and then mucal cells start making what? Mucus to protect itself from the hydrochloric acid. So your stomach's ready to receive the food. That makes sense? This is caused by, you gave me a weird look. Emily, you good or no? Okay, you gave me like a weird look. Okay. Why is it like that? Just give me, oh, whatever. Okay. This is directed by your CNS. Kind of weird to think about, right? Why is this directed by your CNS? Cranial nerves. What cranial nerve? Vagus. It's a cranial nerve, which means it's part of your CNS. Good job. Gastric. This is when food is inside the stomach. You start breaking it down. Num, num, nummy. Start breaking down the food. It's entering your stomach. Party time happening. Interesting enough. What causes the sensation of being full? Do you know? First off, why can I not write? Oh, there we go. Cool. The sensation of feeling full comes from stretch reflexes of the stomach. So the stomach expands enough, you feel full. That makes sense? That's why you can eat, like you can be eating food and then you just take one more bite and then you feel like you're gonna throw up right at that one bite, right? Because it takes time for that signal to reach your brain. That's why you're supposed to eat, wait a little bit, eat a bit more, wait a little bit, instead of gorging yourself on food really quickly. Because that's what causes people to feel that bloated sensation. You should not feel bloated from eating a normal food meal. Either you ate too quickly or you ate too much if you feel bloated. Intestinal phase. Where's the food going now? And into the intestines. Cool. After several hours of mixing, how long does food stay in the stomach for? 2 to 4 hours. So your food stays in the stomach for 2 to 4 hours. That's kind of cool. I think so. So if you ate lunch at 4 o'clock, your food is just now entering your small intestine. Cool. Going on here, as food is leaving, what's going to happen here is your chief cells and parietal cells are going to turn off. Because do you need to continue making hydrochloric acid if your stomach's become empty in a couple seconds? No. And what's going on here, CCK, GIP, and secretin are going to turn those off. We'll talk about CCK, GIP, and secretin in a little bit. But those are going to turn off those things. Okay. Digestion in the stomach. The stomach can hold up to a liter and a half of food. So it's a lot of food. The stomach can break down carbohydrates, amylase. Did I mention amylase from the hormones the stomach can make? Yes or no? So where's that amylase come from? It comes from your saliva. So the food you still ate is covered in your saliva as it goes into your stomach. So that's good there. I didn't mention this a little bit, but there is a little bit of lipase there. What's lipase do? Breaks down fats. But most of your fat breakdown is going to happen in your small intestine. There's a reason why in a little bit. So stomach acid or pH of your stomach is about 2, which is very, very low. Pepsin increases activity at lower pHs. Yeah, most of it's absorbed in the small intestine. Okay, ulcers. So if for some reason cells aren't producing mucus, hydrochloric acid will eat the lining of the lining of the stomach, right? Which forms an ulcer. What do ulcers do? They bleed. So your stomach has a lot of blood in it, right? So if you poop and your stool is a deep, dark red, it means you probably have a problem in your stomach. If you poop and the blood is nice and bright, you have a problem in your large intestine. Reason being, if you leave blood out for a long time, what happens to it? You get darker or lighter? Darker. That's why if you have really dark burgundy red poop, most likely you have a stomach ulcer. Nice. So depending on where the ulcer is located, it can be a peptic ulcer, it can be a duodenum ulcer, depending on where it's located. If it's an ulcer in the duodenum or duodenum, there. Peptic ulcer more in the stomach. They're nasty. Okay. Small intestine. 3 parts. Which part's the biggest? Duodenum, the jejunum, or ileum? Ileum. Ileum is the biggest. Ileum is 16 to 20 feet long. This is the reason why. Duodenum has one purpose. What's the purpose of the duodenum? Do you guys know? No? Okay. We'll talk about that then. Okay. No? Good. It raises pH. The whole function of the duodenum is to raise pH. What's the function of the jejunum? Duodenum, jejunum. There you go. Jejunum. 18-hour days don't work well. Jejunum. What's part of the jejunum? What's the function of it? That's where all the enzymes start being released. What's part of the ileum? That's where all the absorption is going to take place. That's why it needs to be the longest, because all the absorption takes place there. Okay. Small intestine is very vascular. Why? Absorption. You'll even see this on cadavers. It's kind of cool. It's not as clear. It's not as see-through, because the cadavers are kind of disgusting, but you can see the capillaries inside of there. Very, very cool. Okay. Interstitial glands. So they're going to secrete into the stomach. What's the purpose of villi? That's microvilli. What's the difference between villi and microvilli? What? Yes. So villi are these long hair-like projectiles, like these big long ones, and on these long villi, little tiny hair-like projectiles. Those are microvilli. They're connected to each other. Make sense? Okay. What's the purpose of microvilli? What? Why do you want to increase surface area in the stomach? All right, small intestine, you're right. Okay. The duodenal glands. So it's called the Brunner's gland. This is going to help raise pH as it enters the small intestine. Okay. Here's the fun. Oh, it's so weird. I don't know the way it's set up. Okay. Cool. We talk about this and then we go, okay, sure. Intestinal glands. Enteropidase. It's a brush border enzyme. What's that mean? You guys know? Talk about that in a little bit. Enteropidase, enteropeptidase is also going to activate the pancreatic enzymes. Endocrine cells. Hey, endocrine cells. They're more hormonal based. Can that make some sense? Okay. Breakpoint enzymes. They're going to help break up those sugars, those complicated sugars. So they're going to help break down disaccharides and trisaccharides into monosaccharides. So like maltose, sucrose, and lactose are complicated sugars that break down to, maltase, sucrase, and lactase break down to maltose, glucose, and sucrose, and lactose, and glucose. Okay, hydrolyse, what's this mean? Break with water, water salt. Okay. So if I have maltose or a complex sugar and I break it up with water, I make simple sugar. If I have a protein, I break it with water, I make amino acids. If I break up a lipid with water, I make fatty acids and glycerol. I guess just showing that we're breaking up the starch from potato into making sugar. I guess I don't like this picture, especially since the controversy with Miss Potato Head's a thing. Sorry, Potato Head. I think it's hilarious, the controversy. I mean, I don't know why he needs a gender. When I had Miss Potato Head, I would make his eyes I would make his arms the eyes and his ears I would make him a weird like a weird creature. It wasn't even human. It was a weird like arms for eyes person. Okay. Take about 5 hours for food to bypass into your small food from to your small intestine. Blah blah blah. Why do you want it to take so long? Absorption. I'll keep saying this because guess what? It's important. Pancreas. It's exocrine, which means it releases digestive organs, and endocrine, which releases hormones. Inside the digestive system test, are we care about the endocrine or the exocrine ones? The exocrine ones. Good. Okay. The pancreas attaches to the duodenum. So all it's gonna release its hormones, not hormones, sorry, its enzymes very, very quickly. Okay. Pancreatic amylase. What do you think that helps break down? Whoa, where's it come from? Wow, we broke it down. So if you see the word pancreatic amylase, you know it came from the pancreas and it's amylase. Pancreatic lipase helps break down what? Fats. It helps break down fats, but fats are a problem. Who here uses the bars of soap in the shower? None of you guys use bars of soap in the shower? You guys use bars of soap when washing your hands at all? You guys ever used a bar of soap before in your life? Okay, at hotels, okay. Why do bars of soap suck? Okay, that's one thing. When you try grabbing it and your hand's wet. Slippery. Why is it slippery? Because it's made out of fat. You know, old soap used to be out of like whale fat, right? And sheep fat. So the fat in our body acts like that soap. When the enzymes try attacking the soap, it just kind of slips out of it. It works a little bit, right? You get a little bit of suds in a bar of soap, but not a lot. So we need a way to make the soap hard. We'll talk about that when we talk about the gallbladder. Nuclease. What do you think that helps break down? Nucleic acids. Hey, nucleic acids are what? Help make up, what are nucleic acids? DNA and RNA. So name them. What are the acids? What are the building blocks of those? Adenine, guanine, cytosine, thymine. Good. Uracil, yep, uracil cell. Protease is going to help break down that. Peptidase, peptides. Yeah. Proenzymes are enzymes that are activated by a condition. So technically, pepsinogen is considered a proenzyme because it has to be activated by hydrochloric acid. Hey, gallbladder. Here we talk about it. The gallbladder is going to help emulsify fats. That was weird. It's going to help with emulsification of fats, which basically means it makes fats nice and hard and solid, so the enzymes can break it apart. Does that make sense? Otherwise, they kind of slip out of the enzyme's grasp, like a bar of soap. That's what's going on here. Okay. Bile. The only colored part of your cadaver should be the bile part. It's nice and green, because bile is what color? Green. Good. It is stored in the gallbladder, but it's made in the liver. So do you need your gallbladder to survive? No. And my theory is that it's a useless organ that should be removed immediately because it's going to make gallstones. Hey, look it right here. Gallstones. The words col means gallbladder, and this right here just means stone. Cholithiasis. Gallstones. Now, gallstone can be completely blacked up like this guy, go back to this guy, or little tiny parts. Because gallstones harden fat, right? And part of the gallbladder enzyme, right? The bile is fat. So it can technically harden itself. That's what causes the stones to accumulate. Yeah. You just go straight to the digestive system from the liver. Right now, if you're not digesting food, right, you're making bile. It's just your liver can't store it, so it just releases it. So I mean, it means if your gallbladder is removed, you can't eat you can't eat a lot of fatty foods because it upsets your stomach more. But it's not the end of the world. What's interesting, your poop starts floating more because your poop's full of fat food, which is interesting. Okay. Yay, gallbladder stones. I hate them. Okay. Have I had them? No, I've only had kidney stones. I'm genetically disposed to have kidney stones and gallbladder stones, so I'm just waiting. Yeah, my genes suck. Okay. Forgot this stupid image. Oh, I love this image. Yep. Because that's how the gallbladder and liver interact. Yes. No, it's not. He's useless. This can kill you. He's trying, but he's killing people. Sure. He made them great. This is why you're the type of people who put that your kid drew like a crappy house. You put it onto the refrigerator, don't you? I would immediately take it out when he's not looking. He's not gonna. Yeah, I want kids. Yeah, I want parasites. Because I can teach them to be. I can train them to be different. I'm gonna train them. Yeah, you train. Huh? No, it's not. But I'll train the parasite either way. Okay. Yeah, you gotta train kids. Get like a little clicker, make them do things. Teach them to go play fetch. Yeah, I will. Yep. Oh, I'm not teaching that. No, I'll teach them like how to count cards and stuff at a young age. Because blackjack's a really good way of learning how to count. Yes, it is. You count to 21. It's just addition. So you can teach kindergartners how to play blackjack, and then you teach them how to gamble, which is how to lose. Boom, and then you teach them never to gamble. So, pruritus is an itching sensation that can occur in the gallbladder because the gallstone is kind of blocked off, but it's not fully blocked off. So you have this weird sensation in your stomach, like you have to itch it constantly. Yeah. Yeah. Gallbladder's weird. Okay, he's cute. You have one rupture. Okay. Secretin is released when acidic chyme arrives in the duodenum. So this is going to cause a secretion of buffers. Secretin is also going to cause your stomach to stop producing acid. Why? As twofold. It acts as a buffer to the incoming stomach acid and also makes stomach stop making stomach acid. Why? Because you already you digest the food in your stomach, right? Do you need to keep making stomach acid? No. So your stomach goes, oh, secretin's being released. I'm done. I'm going to take a nap, basically, right? And then Warren put a picture of this guy up because this guy was his name was Secretin. I guess. Yeah. Jacques Secretin is a French table tennis player. Which I can't believe that's an Olympic sport. You guys know that, right? Yeah, we suck at it. North Korea is amazing at it. Okay. Cholecystokinin. Brain not work right now. Cholecystokinin. So CCK. Sorry how I memorize it. Is CCK. Again, chol means gallbladder. Cytokinin. Basically, this is going to be stuff from the gallbladder released into the duodenum. This is what's going to cause the emulsification of the fats from the bile. So CCK is bile. Write that down in your notes. You know that. Okay. CCK basically is bile. It has a weird side effect where it actually causes the pancreas to start releasing more hormones. Because the gallbladder and the pancreas are both connected to the duodenum, right? So if the pancreas senses that CCK is around, it releases its hormone, right? If the gallbladder senses that that the pancreas releases hormones, it releases its hormones, right? They kind of look out for each other. And like if one senses the other one, they send up to, they both need to work. Okay. Yeah. Yeah. Oh, right here. So why does eating salad suck? You love salad as a snack or as a meal? So you just eat the lettuce, right? Lettuce, you just eat the vegetables, right? Nothing inside of it, just a salad. What do you eat with it? Why? Why? Because it has what in it? You have to put stuff with the salad to make it feel fulling. You could sit there with a bag like carrots and lettuce. You can eat tons and tons of it, right? It doesn't feel fulling to you, right? It's when you eat when you eat it with the dressing or the meat or like the ranch that has fat in it that makes you feel full. It is fat that feeds us, fat and protein. Make sense? Okay. Okay. So CCK causes it to release it. Boom. Gastric inhibitory peptide. What's it do? This is going to cause insulin to be released. So GIP causes it to do this. So, sorry, should have said this first. GIP, gastric, sounds like what? Sounds like gastrin. Gastrin inhibiting peptide. So what's the first function of GIP? To inhibit what? Gastrin. What's gastrin do? Tells parietal cells to make what? HCl. So you have secretin telling parietal cells to stop it. You have GIP telling gastric cells to tell parietal cells to stop it, right? A side effect is that GIP tells glucose to be released. What does glucose do? Raise or lower blood sugar. Why? Yeah, exactly. So why do you want this to occur? Wait, sorry. No, I messed up. Sorry, it's been a long day for me. GIP tells your pancreas to release insulin. Why? Why? You just ate, you're now absorbing food. So when is your blood sugar the highest? When you immediately start absorbing food. Not when you eat, it's 9 hours after you consume that food, right? It's going to digest in your stomach, then get into your small intestine. So it literally has to, when glucose starts entering your bloodstream is when blood sugar is the highest. So it's usually about 9 hours after eating as your sugar is the highest. Cool. Nice. Tons of messages. That's great. Okay. Gastrin. We were talking gastrin. Yeah. Okay. Well, gastrin was G cells. Okay. Moving on. Boom, 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 boom. There we go. Okay. Up next. You should be in the jejunum, right? No? Maybe. I don't like how this thing is broken up. Okay. Fat-free food sucks. Why? No. Well, kinda. Different way now. You see this in sugar-free food. Same kind of. You guys ever eat sugar-free gummy bears before? Cause the exact same problems, and it caused lots and lots of loose stool. Yeah, yeah. A lot of sugar-free stuff, things that make things sugar-free, causes loose stool as well, because you can't break it down. Yeah, it's basically cholesterol-free things. For the longest time, we were told that fat was bad. Is fat bad? Is sugar bad? Sugar is more dangerous than fat. Because what could sugar cause? Diabetes. Fat doesn't cause diabetes, sugar does. Okay. Yay, my favorite organ. Okay. Liver does everything. It breaks down carbohydrates. It breaks down lipids. It breaks down amino acids. It reduces waste. It stores some vitamins. It stores some minerals, and it cleans us from drugs. So basically, what's the liver do? It does the things that the saliva does the thing the stomach does the thing the pancreas does, and it does the thing the gallbladder does. It does everything. That makes sense? That's why I love it, because it's going to do everything. So it is the largest blood reservoir in the body. Why? Because it breaks down the blood. And that's where we get bilirubin and where you get biliverde from. Cool. It also receives 25% of all the blood, and it's a gigantic organ. So, what does it do? Pathocytosis and antigen presentation. Basically, it will read the cells inside of it and kill it. Makes plasma proteins, albumins, globulins, clotting proteins, remove excess hormones, remove excess antibodies, and remove toxins, and also makes bile. Very, very important. Healthy liver. What's a fatty liver? Huh? It's covered in fat. What's cirrhosis liver? Scarring. So scar tissue. What about scar tissue? What do you guys remember about scar tissue last semester? Has no function. Scar tissue is its own cell. So if I take a heart cell and I cut it and it scars over, it's not a heart cell anymore, it's just scar tissue. So cirrhosis is scarring the liver. So what happens is if I scar my liver with abuse of drugs and stuff like that, it ceases to lose all its function I just told you. And is that dangerous? Because it does everything. Very, 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 very important. Okay. Don't know why we skipped everything else. I guess we're just going to assume the jejunum and the ileum are just going to help absorb everything with these proteins, because we literally are just skipping those. What, you guys doing them? Well, it is a large intestine, but what about the rest of the small intestine? You guys I guess you guys don't even know about those. Okay, sure. Okay, large intestines, I'll refer to as what? Has an ascending, a transverse, a descending, and a sigmoidal function. Cool. Look at those colon pictures. Nice, healthy. Whoa! That's not healthy. What is this? Could be cancer. What is this thing? It's a little nodule. Is that good? when a gigantic piece of chyme comes and pushes against that, I think it's gonna be painful. What about this thing right here? This one right here, I think it's good. It might be a little too red. It might be a little irritated, but that's pretty good. That one's normal one. It looks a little inflamed. Compared to the color of this nice white one right here, it's a bit red, but it could be the coloring of it, but it looks normal. Okay. Large intestines. The main function of the large intestine is to reabsorb all water. So, saliva, stomach acid, all those enzymes, everything has to be lubricated. So our nice fun chyme is super, super liquidy. Is your poop normally liquidy? No. What's the consistency of poop? It's pretty hard, right? Kinda, right? You guys never, okay, never mind. You guys need to put gloves on and go touch animal scat. Yes, you can learn a lot about animals based off its scat. Talk about this in a little bit. Large intestines help reabsorb water. 90% of all the water in our body is reabsorbed via the large intestine and the kidneys. If you do not reabsorb the water and you poop all that water out, what happens to you? Diarrhea. Can diarrhea kill you? Yeah. Dehydration. So that's how you can die, because you're not reabsorbing water from your poop. That's how important your large intestine is. Constipation. You're stuck. You can't poop because it's literally blocking something because it's too thick. How do you fix constipation? Fiber or stool softener or water. So you take stool softener when you're constipated or a laxative, that should help it out. Cool. So less than 10%, so mainly 90% of the job of the large intestine is to absorb all the water. There's a little bit where it's trying absorbing all the leftover nutrients, but there should be almost no nutrients in the chyme and the large intestine, right? Because, here, you reabsorb bile, put it back in the liver, so we like to recycle. Any excess vitamins, we like to reabsorb that. What's going on here? Vitamins produced by bacteria. What? Vitamins are produced by bacteria. You guys know? Vitamin K. Good job. And then bilirubin becomes urobilins, which is just basically going to be what makes your poop brown. Okay. Gut flora. Vitamin K and B. There you go. So you are mainly bacteria. You are a host for bacteria. Bacteria cells outnumber your own normal U cells like millions to one. It's a very interesting study where the bacteria in your large intestine, in your stomach, in your small intestine, and your large intestine actually dictate the food you want because you're trying to appease that bacteria. Scientists have actually found a way to clear bacteria out, and there's some bacteria that love sugar. So if you eat a lot of that, you're going to start craving sugary food. If you start having one that crave a lot of meat, you start craving proteinous food. So there might be a way in the future where you can actually control your gut bacteria to help with dieting. Yeah, it's fun. It's interesting. Vitamin K does what? You guys need to know? Blood clotting. B7 helps regulate blood sugar. B5 is going to help do steroids and some hormones and neurotransmitters. Okay. Sometimes some of the bilirubin is not fully dumped into your digestive system. It then goes into your urine, and you pee it out. Otherwise, you make strictobiliogens, which gives the feces its brownish yellow color. because it comes from bilirubin. What does bilirubin come from? Biliverde. What does biliverde come from? The breakdown of what cell? Red blood cells in the spleen. So your poop is brown and yellow because you're breaking down your blood cells. Also why your pee is a very yellow, very, very dark yellowish color as well. I think that's interesting. Hey, same process. I'm not going to cover it because we already covered it. Unless you guys want me to cover this. You guys want me to or no? Yes or no? Cool. Ammonia. That's bad. Idols and stocktals are going to be nitrogen containing compounds. And nitrogen is a very smelly compound. That's why your poop smells. Hydrogen sulfide. Sulfur is also a very smelly thing too. It smells like rotten food as well. But that's that. So this is why feces is high in nitrogen and high in sulfur. That's why we find it disgusting, because that stuff is very, very dangerous to us as humans. That's why we find poop usually repulsive. There we go. Sometimes we can't digest some carbohydrates, so bacteria feed on it, and they produce gas. So when you're farting, you're just farting, letting out bacterial gas. Yay, I think that's adorable. Yay, farts. No, I don't. I don't know why. Sulfur and nitrogen are flammable, so yes, you can technically shoot out. Yeah, don't do that. You'll come in, if you're a doctor in the ER, you're going to see patients who have burnt anuses because guys have tried doing this. Again, guys or girls, guys are going to do this because they're disgusting and they are dumb sometimes. Again, I shadowed an ER. You see this? It's stupid. It's hilarious. It's stupid. Okay. Appendix. So, what's the function of the appendix? You guys, the teachers tell you? Every year it changes. Did your researcher say it's important this year or not? Okay. Then do what your function said. It's a vestigial organ, which means it had a purpose at one time. We're still doing research. We don't know what it's for. Right? Some theories include it holds a bunch of extra gut bacteria that if we like vomit or take an antibiotic, it can cause it to grow back out, so we don't clear out all our gut bacteria. Some people think that it helped us when we had more of like a grass-based diet or a high fiber-based, like a cellulose-based diet from plants to help break down that. Issue now is the appendix does what mainly? It blows up. Appendix can rupture. Here's your appendix. So that fills up with fecal matter, explodes. Why? Because it's so full of poop that it can't expand. How does it happen? It's connected to your large intestine. So when you kind of when your poop's being moved, it can kind of get pushed into there. There's a sphincter on it. Poop's supposed to be in there. We know poop's supposed to be in there. We just don't know why. Yeah. Appendicitis is inflammation of the appendices for some reason. You have to remove it. Why do you not want your appendix to explode? Yes. Why? What's inside the appendix? Poop. Poop is what? Gross. Do you want all that gross, yucky poop all over your internal organs? No, because it can lead to sepsis, which is basically infections of multiple organs. Is that it? No? Got 22. All right. Yay! Talk about poop now. More poop. Okay. So gastric reflexes, gastral and gastrogenic reflexes move materials of kind you eat into the duodenum. Peristalsis, movements, length of colon, segmentation, basically causes it to break apart into small chunks. As you can see, here, poop is not one solid thing. It's broken up into different pieces, right? It would be interesting if poop was one gigantic long thing. It'd be very interesting, but it's not. It's broken up. Okay. Again, it's the increased surface area. That's the reason. So your rectal chamber here is empty, usually. Why? If poop enters here, what feeling do you get? You need to go, right? And then slowly, what's going to happen, that poop's going to pop out of that little hole right there, and it's going to come out, or you suck it back in. You guys can control that sphincter. I was going to mention that, but yes. Usually, once poop enters the sigmoid colon or rectum, you are going to poop. There we go. Defecation. So, what this is saying is, it is voluntary and involuntary. The lower parts are voluntary, the upper part is involuntary. That make sense? Because you can clench your butthole, you can't clench your sigmoid colon. So, short reflex, long reflex. Blah. So, stimulation of the parasympathetic motor neurons in the blah, blah, blah spinal cord. Stimulates the blah, 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 blah. Increased peristalsis of the enlarged intestine, blah, blah, blah. Basically, what it means is, if you eat food, right, what's going to happen is it's going to move food out of your large intestine. Why? When you eat, why do you have to go poop afterwards? You need to make room for the thing you just ate. So if you eat, it causes you to poop because you need to make room. Short reflex is, hey, there's poop in here. I'm going to poop. That makes sense? Long reflexes are going to cause long-term issues. Short reflexes do short little things. Defecation. This actually is a real chart you guys should memorize. So you guys need to start looking at your poop. If they are look like little turtle pellets, not good. It means you have problems and you need to eat more fiber. Number 1, 2, and 3 are normal. Not normal, they're a little bit. 4 is the best kind, I know that. 2 is you're dehydrated because there's too much cracking involved. That's very painful to pass. 3 and 4 are fine. This might have a bit too much fat. This is getting too liquidy. So, yay. Yeah, type 1 and 2 are constipated. So, fun times. What's diarrhea? Loose stool, loose watery stool. Cool. Common causes is you're sick, your body gets rid of it, or you can get cholera. Cholera is a big cause of diarrhea. Okay, ta-da! Any questions? It's only 9:36. Woohoo! You guys got questions for me? This is my favorite unit because I talk about poop. Because you guys usually are disgusted by it. Next unit is my least favorite because you guys start asking me weird questions. I don't know if you guys will. Huh? Well, after urinary, yeah. Well, some people ask me weird questions about the kidneys, which is fine because I like the kidneys.